Hello, hello, hello. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, August 4th, 2019, and it is time for a regularly scheduled IC support group meeting. So let's see if anybody needs support today. I'm more than happy to take any questions that you might have. You name it, I'm willing to talk about it, my friends. I'm definitely willing to talk about it. No shame, no blame. There's nothing here that we're not gonna take questions on. Now, my goal with these meetings is to make you so strong, so knowledgeable, and so informed that no one can ever mess with you again. We are long past those days of people telling us IC is all in our head. We are long past those days of people saying that there's no treatments. We are long past those days of suffering in silence at home alone. There is hope, my friends. There is hope. More and more patients are finding the answer to their mystery of pelvic pain. More and more patients are getting the treatments that they need to feel better. Things are really looking up. We can be really thankful that it's 2019 because seriously, if you'd been diagnosed 40 years ago, a very good chance that you would have been refused therapy completely. Now, we are simulcasting live on Facebook and YouTube. For those of you that are on Facebook, I would really appreciate it if you could post this on your stream and in your groups, because Facebook has now changed the way they're presenting these live chats. And so I can't guarantee that people are going to see it like they used to. Hello, Pat. Hello, Elise. Hello, Donna. Donna. I took a break from the computer yesterday. I know we've got to talk about IC Awareness Month. I spent the last day or so working on graphics and imagery for IC Awareness Month. And it's just not flowing this time. Normally we get an idea and we can go for it. This time it's challenging me a bit more. Hello, Sherry on Facebook. Hi, Harriet on Facebook. Sharon, Tammy, Rebecca, hello there. Hi, Kay. All right, I hear somebody walking down the hallway. Are they going to come? Okay. We call that family aggro. Now, if you were here with our meeting on Tuesday, you will notice that we had a spectacular day on Tuesday because my 90-year-old mother came running in saying, "Dad has fallen, Dad has fallen." And I'm like literally going, "What?" Dad walks in right afterwards, dripping blood. So I had to stop for about 5 or 10 minutes while I cleaned him up. The good news is he's absolutely fine. Hello, Elaine. Hi, Karen. Hi, Carmela. Lee says, pre-leaf causes you to grow kidney stones because of the calcium. Thoughts? Yeah, that can happen to some people. And so you're definitely going to be somebody who should not be doing any calcium product. So a better shot for you might be a little bit of baking soda in a glass of water. Well, no. Well, baking soda is isn't baking soda sodium hydroxide? Isn't it? I think it is. I have to Google it. Hi, Christy. Hi, Michelle. All right. So, yeah, he's okay. He's okay. So, I need to say something. I want to say something first about what's happened in the last 24 hours. Thank you, Carmela. Yeah, sodium bicarbonate. Okay, thank you. I could barely sleep last night. I really could. I was literally laying in my bed reading my iPad when the news of Dayton came out after the horrifying news in El Paso. And we have got to fix this as a nation. There's no doubt about that. I'm not going to get into politics here. I'm going to get into, I don't want to get into politics here. But this is what I want to say. IC doesn't know any nationality. Pain does not know any nationality. Pain does not know any faith. It is not partisan in any way, shape, or form. Every nationality has IC and pelvic pain. Every faith has IC and pelvic pain. Every sexual orientation has IC and pelvic pain. And I want every single one of you to know that the IC network is a safe place for you, and that I am a safe place for you. I don't care if you're gay or straight or bi or trans. I don't care what race you are. I don't care what religion you are. That's not anything that, I don't even know how to say this. I just want to say to you that anything we can do to love and support each other and to be kind to each other and to comfort each other is so incredibly important right now. I almost moved the IC network to Dayton. I was offered a presidential fellowship at Wright-Patterson Air Force Base in Dayton. I am heartbroken for Dayton. My mother was born in Texas. I have family in Texas. I am heartbroken for Texas. And I truly, truly, truly hope that for those of you who are in Ohio and are in Texas, that you feel our love right now. Because you deserve it, just like California deserves it, because we just had the Gilroy attack. Let us flood the world with kindness and caring and compassion. Let us role model kindness and caring and compassion. Let us role model open doors, not closed doors. Right? Right. I think that's what we need to do. And most of all, the most important thing we can do right now is to get ready to vote. And that's all I'm going to say. Some people say I shouldn't have an opinion. I have an opinion, but I'm going to leave it out of here. Just vote. Whatever you need, however you prefer to do it, I need you to do it. All right, my friends. Karen says copycat phenomenon. Could have been. Hard to say. Kay says, I'm just very upset with all that's going on. We in Texas are grieving. I know, hun. I know. We have to make our homes safe places for anyone and everyone. You got to understand. My family background, my grandparents and great-grandparents came from Norway and Sweden. They were not very good at cultural acceptance. And with each generation, it gets better and better and better. And I'm telling you, my generation, the door is open, my friends. If you have pain, we are here to help you, period. There will be no questions on where you live, what your color is, all that sort of stuff. There just won't be any. All right? All right. I know I could have said that better, but it is what it is. I hope you understand what I'm trying to say here. All right. So, hey, I want to talk, Carmela says, my pelvic pain is from so many sources and it's horrific. I'm sorry, hon. Let's see if we can figure it out here. I had to make my parents waffles this morning, and so I didn't get to prepare quite like the way I wanted to, but there was a very interesting study that came out that I wanted to go over with you guys real quick. So hold on a sec. Let me find that. Where was it? I think it was in the Journal of... Hey, man, I'm a nerd. I'm a total geek. You should just see my email. I get all this stuff. Was it from the Urology Times? Nope. Where is it? So, yes. All right. In the International Journal of Urology and Nephrology. So that's a journal focusing on the urinary tract and the kidneys. So we have yet another research study, which is, but this one is from Boston, from Tufts University and Turkey. And this is kind of following this new debate, this old yet new debate that we are currently having about the role of bacteria and infection as a potential trigger for interstitial cystitis. Now, y'all know that I do not put all of my eggs in the infection basket. Okay, why do we not do that? Because it's really crystal clear that for some people, IC can begin after having a baby or a car accident or a fall. For some, genetics is at play where there's a genetic connection. For others, it can be the result of a chemical injury or trauma to the bladder, chemocystitis, anything at all like that. And as you know, as we ponder these subtypes for IC, these variants of IC, there are subvariants. So we've got 5 key variants. So we got Hunter's lesions, bladder wall driven, pelvic floor driven, neurologically driven, and central sensitization. So those are our 5 variants. So remember, 25 years ago, we all thought of IC as a bladder disease. We don't think of that anymore. We think of it as a pelvic pain syndrome, of which many different things can be involved. Now, in the bladder wall injury or bladder wall driven subtype, there are subtypes. There are variants in there. So variant number 1 is chemo-induced cystitis. So chemical irritation, because the bladder, like any other part of the body, can be damaged. Another subtype is menopause, the genitourinary syndrome of menopause, that changes in hormones affect your bladder's ability to defend itself. And also in this subtype is the role of chronic infection. We now know that there can be chronic fungal infection, and there can also be chronic bacterial infection. Now, again, remember, it was all or nothing 20 years ago. All or nothing. Everybody was saying, what kind of those passionate interest groups like to say is that it's all or nothing, that everyone has bacterial infection or everyone has Lyme disease or everything like that. And believe me, that is not true. That is not true. However, perhaps, just perhaps, the whole chronic bacterial infection has been pushed aside inappropriately by researchers. Why do I think that? Because now we know, why does my top keep falling off like that? That's going to drive me crazy. Okay. Now we know that a typical urine culture is not effective in identifying infection. That a typical agar plate urine culture, it's a round plate with a growth medium on it. And depending upon the growth medium you use, you have the potential of growing out different types of bacteria or fungi. So we have long known now that urinalysis is not effective, that it will not grow out the vast majority of bacteria that can live in the bladder. And hold on a sec. Hold on. Somebody, you know what? Hold on a sec. Oh, she hung up. That was somebody here from Facebook. All right. So we now absolutely can grasp the fact, now that we have next generation urine testing, now we know there is a robust population of bacteria that are supposed to live in the bladder, that the bladder is not sterile, urine is not sterile. There are good bacteria that are supposed to be in the bladder. And what that next generation test has proven to us is how ineffective traditional urine cultures are. Because urine cultures didn't find those, but the next generation test did. So we have yet again another very, very strong movement online that's pushing for a greater respect for and understanding of the fact that some of us could potentially have a chronic infection that has not been identified properly. Now, Dr. James Malone, who is a retired doctor from the United Kingdom, although he is James Malone Lee, is publishing extensively and still has. He's got over 180 journal articles. His entire career has been dedicated to the study of infection. He argues very successfully that because no urine test is really accurate, and even if it finds a bacteria, do we know if that bacteria is the cause of your symptoms? He says the correct way to make a diagnosis of infection is to look for leukocytes. So what he now does is when somebody gives a urine sample, they actually put it under a microscope and they look for white blood cells. And if white blood cells are present, then they assume that some sort of infection is going on. And then based upon, I don't quite understand how he targets antibiotics. It's some sort of narrowband long-term antibiotic protocol. But he argues that the best way to diagnose infection is not by trying to grow anything else at all. It's just to look for the presence of pus and maybe some other signs. So here we have a new study that is called A New Look at the Etiology of IC and IC Bladder Pain Syndrome, Extraordinary Cultivations. So far, studies have not clearly identified infectious agents as an etiological factor for IC, in other words, for causing IC. Specific microbiological diagnoses for detecting the pathogen with higher sensitivity in IC may decrease treatment costs and increase the health of patients. Okay, yeah. Methods, what do? They did a clinical study on 26 IC patients and 20 controls between April and September of 2017. All participants were asked to give midstream urine samples for routine urine cultures. You know what? And I got to say something about that. Now, y'all know, you don't know, because even I really didn't even understand this, is that whenever you leave a urine sample, they always say pee out. You can't take the first pee, that you have to like wait a couple of moments, let some urine run out of your bladder, and then you grab what we call a midstream catch. So the question is why? And it turns out that there's settlement involved, the first little bit of urine coming out is going to have an abundance of skin cells and potentially bacteria and other things that are just settling in that area. I hadn't really thought of it that way, that your urine is a suspension and the heavy particles are going to drop to the bottom, right? I mean, I think that's really fascinating. Okay, I can find the source for that if you want. I saw that last week. Okay, so prospective clinical study was performed on 26 IC patients, 20 controls between April and September 2017. All participants gave midstream urine samples for urine cultures, followed by negative results. Symptomatic, so these are patients who still had symptoms. Symptomatic patients were evaluated for an L-form pathogen existence through extraordinary cultivation methods. Biopsies were also taken from 19 patients with lesions on the bladder while collecting sterile urine samples from 26. So here's what they tried to grow it out on. They tried to grow it out on a normal broth. They tried to grow it out on 5% sheep blood agar, on EMB, on a dextrose solution, on something called LEM, and it's something else called GIPA. So here we've got 6 different growth mediums. Followed by the first day inoculations, all broths were subcultured. Oh, wait, you don't need to know that. Yeah, you don't need to know that. Here, okay, so here's the result. Bacterial isolations were yielded from samples of 13 patients with a broth. 8 had Pseudomonas, 2 had Klebsiella, 2 had Candida, and 1 had Enterococcus. Antibiotic susceptibility tests were performed. And somehow the median symptoms were lower. Okay, and somehow the median symptom index and scores of those 13 patients were lower after the appropriate antibiotic treatment. Okay. And they concluded extraordinary mediums with longer incubation periods may reveal a causative pathogen in the etiology of IC. Future culture techniques may have some value because still some of IC patients are describing symptomatic relief by a group of antibiotics. So look at it this way. If somebody didn't have infection, but they responded to an antibiotic, why? Why? Why would an antibiotic help? Well, in the old days, what we used to say is just because antibiotics also have an anti-inflammatory effect. But again, Dr. James Malone Lee and others, what they're arguing instead is no, that they actually may have an infection that you just can't find, that you just cannot identify. And so the therapeutic question is it cruel to take that patient off of an antibiotic when it's helping them? And again, Dr. James Malone Lee says, yeah, I think it is cruel. So we are at this really, really interesting phase right now of reconsidering some of our old belief structures. Now, interestingly, if you saw about a month ago, there was a really good article in the Washington Post that talked about an IC patient who went through, I think, Dr. Malone Lee's protocol. They found a bacteria. She treated with antibiotics, and now she's massively better. And the point of that article was to say that many patients diagnosed with IC might have infection, and we need to improve that diagnostic criteria for that. And you can't deny she's better, and you can't deny that the next generation testing found bacteria. You can't deny that. It is undeniable. And yet, the ICA and Dr. Robert Moldwin, who is a lovely, lovely man, they sent a letter to the editor of the Washington Post saying that article was misleading and giving potentially dangerous recommendations, that the use of long-term antibiotics has consequences from C. diff infections, candida infections, and all that sort of stuff. So it's like we're being pulled from both sides. I mean, we got this side over here saying antibiotics. We got this side over here saying no antibiotics. We got this side over here saying bacteria. We got this side over here saying no, there are no bacteria. And it's like, what the hell do we do next? What the hell do we do next? And the answer is, honestly, next generation testing. Even though Dr. Malone Lee doesn't like it, he says, even if the test finds bacteria, you can't guarantee that that's a bacteria that's giving you the symptoms. It's hard data. It's hard data. At least we have some facts. Nobody's guessing. And that's what I don't want for you as a patient. I don't want people guessing anymore. You know, I mean, think about a guy diagnosed with IC. So he's got frequency urgency. Most doctors are going to say you got chronic prostatitis, throw him on antibiotics for 6 months. That doesn't work. You go back to the doctor. The doctor goes, maybe you've got, prostatitis. Maybe you've got another prostate syndrome. They throw prostate meds at you. That doesn't work. They go back and they go, oh, well, let's take a look at your bladder. Maybe you've got IC. And then they throw Elmeron at you and all sorts of stuff like that. And those don't work. We have to get better at this. And the flaw in what happens to that typical man is everybody's guessing, and we have to stop guessing. We need facts. You need facts. So now when you go to a doctor, that's really, I've said this over and over again, is I don't want you to walk into any new doctor's office and say you've got IC. Please don't do that. Because you're going to fall down the rabbit hole of whatever belief structure that person has. I want you to walk into your doctor's office and I want you to really clearly describe your symptoms. Doctor, I'm fine when I stand, but when I sit down, it hurts. That's important. Doctor, when I have sex, I get pain at the tip of my penis. Or if I'm a woman, I get pain not during sex, but I get a flare afterwards, 6 to 8 hours afterwards. Or doctor, when I do this, it hurts. Or, I mean, and you have to pay attention to the little weird symptoms that you wouldn't even think about mentioning to your doctor. So is there a spot? Is it on the left side? Most IC patients don't have a spot. Like, seriously. So if you can, okay, so bear with me here. So look, here's the top of my legs, right? So here's the triangle from hip bone to hip bone. Your bladder is centered. If you got pain to the left of center or to the right of center, we're not looking at the bladder anymore, my friends. We're probably going to be looking at the muscles, okay? One of the things that you can do is find your hip bone, and just gently push your finger your hands right on the inside of your hip bone. Does it hurt? Is it tender? If it is, that's your pelvic floor. That's your pelvic floor. So again, it's the weird, unique things. It's the little odd things that you might not think of mentioning to your doctor, that it will often shine a light on what your fundamental problem is. Do you have terrible cramping during your periods? Do you have profuse bleeding during your periods? Then we're going to look at endometriosis. We're going to look at fibroids. We now know that if you've got a fibroid pushing on your bladder, that can trigger all the symptoms of IC. And we also know with valid research that when that fibroid is treated, the IC patients are mostly cured of those symptoms because they were never IC patients in the first place. They were fibroid patients. Let's see what else. Do you have any other pain-related conditions? Do you have IBS? Do you have a sensitive stomach? All that sort of stuff. Those are all relevant to this diagnostic process as we try to figure out what's going on with you. So there's this whole checklist of things that you've really got to try to work through before you accept a diagnosis of IC. One of the things that any good doctor is going to do is they're going to do a urine screen. Granted, we just talked about it, but they're probably going to check for every sexually transmitted disease known to man. And that's okay. That's okay. If they want to do it once, I got no problem with that. You could say, hey, doc, I'm a virgin. They're going to do it anyway. And you know what? That's okay. It's just hard data. Let them get it done. Let them do their protocol. Be over. I just had, because I had an outbreak of vulvodynia, I had a doctor who wanted to do a herpes test on me. And it's like, dude, go to it. It's going to be negative. I can promise you. And it was. Don't be offended by those tests, because testing gives you hard facts. So again, at your first appointment, you're not going to say you've got IC. You're going to describe your symptoms. And then you're going to ask, doctor, can you please help me understand what in my pelvis would be triggering this symptom? What could trigger this symptom? Could it be tight muscles? Could it be something related to my bladder wall? Could it be related to estrogen atrophy and the quality and health of my skin? Does that make sense? Yeah, I hope that kind of makes sense. I'm a little bit rambling today. I apologize. Carmela says, I have microscopic blood in my urine all the time since childhood. I'm 60 now. So we've got this kind of two diverse theories here. Theory number one is we've got microscopic blood and red and white blood cells in our urine because there might be infection. Theory number two is we might have red or white blood cells in our urine because of injury. And let me explain that. Sorry, if you hear that, that's my footstool. Sorry about that. Whoa! Oh my God. All right, now y'all know this is not a good live event. If something doesn't fall in here, hopefully it won't be me. It could be easily. All right, so here is a mock-up, a three-dimensional mock-up of your bladder, right? So you've got a top layer of mucus. You've got four layers of urothelial cells. We call these umbrella cells. And this is basically your skin. And then you've got underneath that blood vessels and nerves, right? Okay. So if you have a normal mucosal barrier, this mucosal barrier prevents bacteria from reaching here and prevents irritants from reaching here, okay? So remember, your bladder is like your mouth. It is a hollow organ covered with mucus, and that mucus has a purpose. It's a nice thick barrier. You know, when you have a dry mouth that hurts, what do? You drink liquid. Your mucous membranes are supposed to be wet. Your bladder is supposed to be wet. It is supposed to have this nice thick coating of mucus. If you don't have this coating of mucus, let's say you've gone through chemotherapy or you've used ketamine or you're a diet soda drinker and you've just fried your bladder, look what happens. You lose this mucus, and so anything in your urine is now reaching this area. And this is where the miracle of the human body is the most impressive, because these cells, they're not just passive, they're active. They have all sorts of ways of communicating to the rest of the body about your health. And so what happens is if a bacteria gets down here, or an irritant gets down here, or a byproduct from smoking that's in your urine gets down here, these cells call for help. They call for help. They tell the body something is here that should not be here. So then what happens is your body mobilizes blood cells to rush to the area, specifically white blood cells, because white blood cells are your army. White blood cells are the soldiers that help kill infection in your body. So coming up through these blood vessels, and you can see these right here, comes this army of white blood cells to fight whatever is here. So question number one is, well, how do they get there? Okay, I mean, so like they're in the capillary, they're in the blood vessel, but they're not up here. They're not, I mean, you got an irritant right here, but the white blood cells are right here. So how the hell do the white blood cells get here? And the answer is that your capillaries release them. Your capillaries, your little tiny microscopic blood vessels, open up and they release white blood cells and they release red blood cells into the area. Well, the red blood cells are accidental. The white blood cells are purposeful. So they release these cells into this area to kill whatever's there. And if it's bacteria, then you're gold. You know, you're gold. They're going to kill the bacteria. But if it's an injury, if it's a smoke a chemical, something like that, there's nothing to kill. It's a chemical. It's just a chemical. Eventually, anything that gets released here is going to end up in your urine. And so that's kind of the theory that we have about why IC patients often have microscopic blood in our urine. It's because it's just part of the body's healing process, the bladder's healing process in a way. And yet Dr. Malone argues, and I don't have a good rebuttal for that any white blood cells in the urine are suggestive of infection. And we need to interview him, and it would be great to come do a live meeting with him. It's definitely, everybody's guessing. Everybody's guessing. So if you think you have infection and you want to know, then the best thing that you can do is just have a next generation urine test, my friends. You know, I mean, if you want to know the hard facts, now, of course, the problem is your doctor going to know what to do with the data? And the answer is probably not. Are you going to know what to do with the data? Probably not. But it is hard data. It is hard facts. And I prefer that to a guess. I mean, especially if you're continuing to have, if you've got any other signs of infection, you've got fever, your symptoms are getting worse and worse, you're progressively getting worse, et cetera, then why not have a next gen test and just take a look and see what it can find? And I can show you mine, so if you want to see them. So look, I had a next gen test from Microgen a couple months ago for vaginal irritation. I was curious, and here's what it found: is I had Lactobacillus gasseri, I had Privitella, I had a Streptococcus aeruginosus. Is that what it was? And then I had a little tiny bit of Gardnerella. Okay, what does that mean? Well, most people would say that those are very minor results, that the lactobacillus is completely normal. However, the Prevotella and the Gardnerella are suggestive of bacterial vaginosis, a common affliction for those of us who are indeed menopausal. Oh boy. So if you go to bladderhealth.org, you can go ahead and just order up a test. It's available. You can order it yourself, I think, in 25 states, and the other 25, you need a doctor's signature. But it might be useful. You know, we just have to be, you got to be a soldier here. You got to work as hard as you can and try to answer as many of these questions as you can to try to rule stuff out so that we can find your unique cause of pelvic pain. All right, I'm going to stop talking here. I mean, free associating here. And let's take your questions. You can tell I didn't get a lot of sleep last night. I was pretty upset last night. Kathy says, what can we do for bloating and how to lose weight with IC? Okay, so I think you're talking about the IC belly. So what happens is when we have a flare, our belly can swell suddenly. So you can wake up in the morning and it feels like, you've got a flat stomach, and then 3 or 4 hours later, you look 5 months pregnant. And that really is just inflammation in the bladder. That is not extra weight. That is not extra fluid, anything at all like that. That's just a sign that your body is in a flare at that moment. So don't assume that that's extra weight you have to lose. It comes and goes. However, we all have to admit that the IC diet absolutely is a high carb, high sugar diet. And we know that carbs are evil, when it comes to weight gain. And so I think the best thing that you can do is try to eat simple, fresh, healthy food. Meat is your friend. I just don't want you to have barbecue sauce or steak sauce or anything like that. Just keep it simple. You can grill up a steak. You can have chicken. You can have fish, whatever you want. Just don't put a spicy sauce on it. The vegetable aisle is your friend. The vast majority of vegetables are IC friendly. Keep your cut back a little bit on your fruits because fruits tend to be high in sugar. But even with fruits, you can get away with an apple a day, a pear a day, blueberries. My favorite fruit right now are blackberries. That's what I've been having for dessert. I made blackberry pancakes this morning. And with respect to drinks, you got to go for preferably just a plain water rather than something that's fatty. Although, listen, there are times when you just need a comfort food. Preferably not every day. Also, another really interesting thing is what are you going to do for your snack? There, let me turn the air conditioning on. It's getting hot. As you can tell, I'm starting to sweat. My old snacks were, because I have gained weight since I had my surgery, and I'm now losing it successfully. And a big change for me was the snacking that I was eating during the day. Now I'm eating celery with almond butter, where before I was eating potato chips or tortilla chips or guacamole, or, something at all like that. Rebecca, can you recommend the best book for me? I suffer with allodynia and hyperalgesia of the pelvic floor muscles. Is there a book about the girl? Have I got a book for you? Hold on one sec. All right. So I think the best book, in my opinion, is this book, Ending Female Pelvic Pain by Isa Herrera. You will learn more in 5 minutes reading this book than you will have learned your entire life about your pelvic floor and how it works. For men, they have the same one, only it's Ending Male Pelvic Pain. We also have a book written for men and women called Heal Pelvic Pain by Amy Stein. This is very good. Absolutely. Absolutely. And Amy also has a really good DVD. I forget the name of it, but it's available too. And then, of course, we have Nicole Kozian's IC Solution. And she is a physical therapist. This is the latest book written on IC. She's the first physical therapist to really talk about the connection between the bladder and the pelvic floor. And I think she did an absolutely fabulous job. And so you can get all these in our store. Hey, guys, I need to get a drink. I'll be right back. All right, sorry about that. Sorry about that. I'm a girl. I have to do stuff. All right. Jody says, prior to being diagnosed with IC, you were diagnosed with kidney stones. It started a year before your IC diagnosis. Since then, you've been diagnosed with rheumatoid arthritis, fibromyalgia, Raynaud's disease, Sjogren's syndrome, possibly Pott's disease. Whoops. Oh, sorry, my computer just went like that. So Jody, you're going to be in the autoimmune subtype. You know, you're in that small group of patients where there's clearly an autoimmune variant. And we can say that because of the Sjogren's syndrome very, very specifically. You know, some people like to say that ICU is an autoimmune disease for everyone. That is absolutely not the truth, but it is for a small subset of patients. Rebecca says that Dr. Malone is your specialist. Awesome. And she says, Professor Malone looks at a sample that is unspun and unstained. It has to be looked at within 2 hours. Hi, Fawad. Nice to see you. Veronica said she read on the internet that IC is autoimmune disorder. Do you have any information on it? Again, Veronica, what I just said is it's only for a small subset of patients. Listen, you got to understand that we are not all the same. We are not all the same. That some patients have muscle injuries, some patients have potentially viral infections, other patients might have a fungal infection, some might have a childbirth injury, some might have some genetics at play. We cannot make the blanket statement that every patient is an autoimmune patient. It just does not work that way. Rebecca says, Professor Malone Lee is amazing. It's helped me so much. And I now don't show chronic infection after suffering for 20 years. So Rebecca, I'd love to hear how they treated it for you. And yet here we have Sean, who took doxycycline for 1 year with no help. So question number one, Sean, is if it was infection, could the bacteria have been resistant to doxycycline? It's possible. Sheba says, how do you tell the difference between a bladder infection and an IC flare? You know, it's actually, I've always believed that it was very easy to know the difference, because in my experience, whenever I've had bladder infections, my urethra screams. And it's that urethral irritation that really distinguishes a major bladder infection from a typical bladder wall IC flare. Extremely hot, burny, sharp, searing pain in the urethra with infections. It tends to be very common. You got to remember, the bladder only knows one language: frequency, urgency, pressure, pain. So everything feels like infection. You could have a bullet wound and it would feel like infection. You could have a stab wound and it would feel like infection. You could have cancer and it would feel like infection, because the only way that the bladder can tell you there's a problem is by giving you the symptoms of frequency, urgency, pressure, pain. It just is what it is. And so, it then becomes kind of a reality check as well as a journey of due diligence. Many ICers, myself included, I can't tell you the number of urinalysis that I had. And now that we have subtyping, and now that we've looked in my bladder, I know that my bladder wall is healthy, that I'm not somebody who has lesions on my bladder. My problem is muscle driven. So all those flares that I thought were from an infection turned out to instead be from tight pelvic floor muscles. So Rebecca says, professor looks at unspun and unstained urine within 2 hours. Unfortunately, the only treatment for chronic UTIs is high-dose long-term antibiotics, which then, again, we have the tremendous risks associated with long-term antibiotics. I mean, we're really stuck between a rock and a hard place here. And when we take antibiotics, the reality is that we're killing everything. We're killing the good bacteria and the bad bacteria. I don't have the right answer here. I mean, it's hard. Catherine says, I'm on Pliocin for staph. It's killing your bladder. I'm taking probiotics as well. Any suggestions as to how to stop that pain? Is it staph, or you have a staph infection in your bladder? You have to let your doctor know that your antibiotic is absolutely killing you, and maybe they can use another antibiotic instead. Or you might need to use some pain medicine or something like that, or maybe some azo or pyridium to numb your bladder wall. Tracy says, I've been on Elmeron for 1.5 years, and I feel like I'm experiencing memory loss. When taking it, I forget what I'm saying. It's like brain fog. It's been going on for about 1 year now. Could it be the medication? Tracy, Elmeron is not considered in that risk group for cognitive decline because it's not an anticholinergic medication. However, let's just cross our I's and dot our T's here for a moment. Let me pull up the Elmeron product spec sheet. However, if you were taking amitriptyline, imipramine, nortriptyline, hydroxyzine, or any of the detrols, ditropans, oxybutanins, that could easily be linked to your brain fog. So hold on a sec. Let me look here at Elmeron for a moment. I'm not seeing anything related to cognition here, Tracy. Of course, the best test, though, you need to let your doctor that you're worried about it, and see if you can maybe reduce your dose and see if that would make it better, or maybe stop the medication for a period of time. Remember, Elmeron is also associated now with eye disease, and so many patients are stepping away from Elmeron and using other things. Ravonda said, can desert harvest aloe cause stomachache, nausea, abdominal pain? Yes. Yes, it can. Some people are absolutely aloe intolerant. Rebecca says, I would like to know what chronic UTI sufferers like myself are supposed to do if doctors are against long-term high-dose antibiotics as treatment. Man, hun, that's the ethical debate, hun. I think that as we look at the potential side effects of medications, it is an undeniable fact that when you take an oral medication, you're at risk for more side effects. Whereas if you put the medication directly in the bladder, you're getting 100% of the medication directly in the bladder, and you're not getting as much systemic absorption. So I have to wonder if antibiotic bladder infections. I mean, okay, intravesical antibiotic treatment, if that's going to be the future, because then 100% of the medication would be directly where you would need it the most. You know, and there was a device, I think it was called EMDA, and it came out of Italy, electromotive drug assistance or drug delivery. So what they did is they put a little electric current in the catheter itself. And when you fired off the current, it allowed the medication to go deeply into the bladder wall. So it makes you wonder, would that be an interesting way to deliver antibiotics, or liposome therapy? Where liposomes are little tiny circles, little tiny round circles of, or spheres of a fatty substance that, because it's fatty, it will cross into the bladder very, very easily. And what they do is they put medicine inside that, like Elmeron or even chemotherapy. I mean, liposome therapy is definitely the future too. Ultimately, though, in the end, Rebecca, there are a couple of other things that they might want to start using. Something called a bacteriophage. A bacteriophage is a virus that has been adapted to go after bacteria, and or remember that ultimately the biome is about good bacteria and bad bacteria that are kind of in a harmonic balance, or maybe a little bit at war with each other. The good bacteria keep the bad bacteria in check. And so I think what we're going to see in the near future is the treatment of infection with good bacteria, putting more good bacteria in there to kill the bad bacteria. But that's in the future, although I just read a study about that too sometime in the last 2 to 3 months. This is what happens when I don't get enough sleep, is my memory is not as good. I'm sorry. Rubina, can menopause trigger IC symptoms? Absolutely. Yes, absolutely. Absolutely, Rubina. We call that the genitourinary syndrome of menopause. That is because this top mucosal barrier is estrogen dependent. So when you're young and you have lots of estrogen, you have lots and lots of mucus. When you're older and you enter perimenopause and menopause, your estrogen levels drop. Therefore, this layer gets thinner and thinner and your tissues get drier. So yeah, that's a reality. Joanne says, my urine used to be bright red with blood from 7th through my teens. Before I was diagnosed in my 20s, I was treated with long-term nitro. Girl, that is very odd. That is very, very odd. Didn't they look in your bladder and to see what was bleeding? And do you bleed now? I mean, it sounds like you were treated. So, I mean, the operational theory here is they thought you just had a very, very intensive infection that was causing the bleeding, and that you're treated with meds. Today, I think we would be wanting somebody to visualize the bladder and see if they could see any wounds bleeding. Could you have had a bleeding Hunter's lesion? That's a possibility. Shotzi said low estrogen left her with a hypersensitive bladder. She does better with estrogen. Carolyn was in remission for 8 years with amitriptyline, started with urgency frequency in May, had ultrasound that shows moderate size fibroids at the top of the bladder. How will they treat that? Carolyn, I just did a big article on that. Where is it? Here it is. So this was our winter IC Optimist. Now you guys, you can get our magazine, the IC Optimist, over in our shop. This is our 16th year of doing this magazine. We're very proud of it. Hold on a sec. Let me find this article for you. Well, it would help if I looked at the index, don't you think? Oh, all right. So here we go. I should have remembered it was my editorial. I write this along with Stacy Shannon, as well as a lot of guest writers and even patients who are sharing their patient stories. All right, so let's look at this for a moment. Fibroids are benign growths. They're benign tumors. They can be inside the uterine wall, like here or here. They can be protruding into the uterus itself, like here or here. Or they can be coming out of the uterine wall, like this one. And so, let's see. So let's see. The reason why I wrote this is because there was a very, very good research study that was released earlier this year, where they were able to determine in this strong population of fibroid, quote unquote, IC patients, that fibroids were driving their symptoms. And so when they removed the fibroids, their symptoms went away. So when fibroids are quite large, they can put pressure on the tubes that take the urine from the kidney to the bladder, and they actually cause the kidney to enlarge, yada, yada, yada. Large growing fibroids can trigger pelvic pain and pressure. Patients report a heaviness in the pelvis, or they might even feel a large mass when they press into their lower abdomen. They can become so large that a patient may look pregnant. Just last year, a 61-pound fibroid was removed from a 53-year-old woman. Holy, 61 pounds. Dang. So what are the risk factors? Fibroids are more common in women as women age, especially during the 30s and 40s. Patients with family members with fibroids have more risk. If your mother had fibroids, your risk of having fibroids is larger. High blood pressure, vitamin D deficiency, and no history of pregnancy may also be risk factors. In contrast, pregnancies appear to reduce the risk of fibroids. That's very interesting. One preventable factor of fibroids is obesity. Very heavy women have 2 to 3 times the risk of developing fibroids. Why? Because estrogen is stored in fat. That's one of the theories behind the menopausal belly, which is so interesting, is why do we women who we get past a certain age, all of a sudden we have a belly we didn't have before? Why does that get turned on? And kind of one of the theories behind that is because the body is looking for a place to store and hang on to the last little tidbits of estrogen that we have. So we know that estrogen is stored in fat. So when you are obese and you have a lot of fat, you can have a lot of estrogen in your body that can be triggering the growth of the fibroids. And there's a more academic explanation of that too. The excess belly fat we can develop may produce excess estrogen that can circulate through the body into the uterus. There you go. Treatment, number one, they want you to start with the least invasive therapies first. So number one, they want you to avoid any foods that contain estrogens. They suggest what they call an anti-estrogen diet, including a lot of cruciferous vegetables, garlic, carrots, beets, drinking plenty of water, foods that contain carotenes, foods that contain vitamin E, natural inflammatory foods. They even recommend green tea, although, hello, people, do not drink green tea. Green tea will kill your bladder. Don't do that. They want you to avoid red meats, alcohols, animal fats, cheese, cream, because those all have the potential of raising levels of estrogen. If you're obese, or just heavy, they want you to lose weight. And then there are some oral medications that can be used that can put you into a fake menopause, an androgen to stop menstruation and shrink tumors. And or they can do a minimally invasive procedure using an IUD, perhaps. They can, uterine artery embolization can cut the blood off towards a fibroid, and is recommended for women who would like to have more children. They can use a MR-guided focused ultrasound completely non-invasive way to treat small to mid-sized fibroids and or surgery. So Carolyn, if you want to read this article, you just need to go over to our shop, and you can order it for, I think, $5. You can order the magazine for like $5. This is a past issue. Might be $8. I reduced them after a year. All right. Hi, Tanya. And you guys know, listen, please don't be offended if I miss your question. They scroll by very quickly. Let's go down to YouTube for a moment. Elaine says, thoughts on urethral pain. I tend to amp up about an hour. It tends to amp up about an hour after you pee. Often feels better if you've got a somewhat full bladder. Okay, so what you're saying is that you're not saying it hurts when you pee. You're saying it hurts after you're done peeing, but the fuller your bladder gets, the better you feel. Oh yeah, that's unusual. I don't have an explanation for that. For urethral pain, we're going to look at estrogen atrophy. We're going to look at tight muscles. We're going to look at an infection of the periurethral gland. And most of all, we're going to look for chemical irritation. If there's some sort of chemical, whether it's from a menstrual pad or a soap or a laundry detergent or a fabric softener that could trigger some of that urethral pain. I've got a really good article over on the IC Network website that's called The 7 Causes of Urethral Pain that you can go find and read. Elise says, do you know what is in green tea that can be triggering to the bladder? Yes, caffeine, number 1, and number 2, remarkably high levels of acid. I'm telling you, whoo, green tea flare. If you got Hunter's lesions or bladder wall injury or estrogen atrophy, is brutal, my friend, brutal. I was working with a patient last week who was doing a lot of green tea, and she was just crying in pain. She had no idea that green tea was irritating. Oh, and what else was she doing? Oh my God, she was doing this. Okay, it was in a tub, and it had the word red in it, like carne red, and it was this big vitamin powder thing that she was making a drink out of, and the poor thing was suffering so badly. And we're just kind of like going through, it's like, okay, are you taking a vitamin? No. Are you doing this? No. Are you doing this? No. And then it's like, okay, is there anything else you're doing? And she goes, yeah, I'm doing my drink. And I was like, well, what's your drink? And she's like, well, it's this like carne red thing. And I go to it on the web, and it's like the worst of the worst of the worst for IC. It had cranberry in it. It had lemon in it. It had lime in it. It had green tea in it. And holy moly, was that why she was up every single night. Kay says, what about toilet paper? Any research been done? As a matter of fact, I've been working on an article on toilet paper, and Consumer Reports did a study with toilet paper, and the brand that was found the best for softness and durability and all that stuff, I think, was a Walmart brand. I've always sworn by the Costco brand. Costco actually scored substantially lower down the scale. I was really, really surprised to say. But I think the key thing is paper fibers. Paper fibers. When you use toilet paper, it's not just about the texture and the softness or hardness. It's about, is it leaving any paper behind that could be embedding in some of that tissue? And that's why ultimately using a peri bottle and rinsing yourself off with water, pat dry, and maybe even using a peri bottle again, to get any paper residue that might be off there. I just switched to a bamboo and sugarcane toilet paper that is supposed to have far less paper fibers. Robin says, something that worked for her to heal bacterial infection were compounded antibiotics. They were made into a liquid and instilled directly into the bladder. Yes, and that is Robin, that's absolutely better because it's not getting systemic. And all the medication is exactly where it needs to be, which is in your bladder. Joanne had her bladder removed at the age of 30. You had Hunner's lesions. You're now on a nitrofurantoin post-removal. 6 infections this year alone. Ended up being admitted for 7 days with IV ooh, girl. Oh, I'm so sorry. I guess regardless of the pain, I mean, regardless of the infection, how's your pain level? How do I spell biome? The way you just spelled it with an E on the end. B-I-O-M-E. Rubina says, should you take estrogen? The answer is you got to talk with your doctor about it and learn about it. You know, topical estrogen, which used on your skin down there, is much less risky than oral estrogen. When you take oral estrogen and you swallow it, it's going to be distributed throughout your body. And that's why there's an increased risk of breast cancer and uterine cancer, which, hello, I went through 2 years ago from taking oral estrogen. However, topical estrogen is considered much safer. It does not become systemic to any great degree. And I still use topical estrogen frequently. Jennifer says, I finally got into pelvic floor therapy after what they think was pelvic floor spasm. You're left with vaginal burning, heaviness, frequency, constipation, back pain. And she found no tight muscles. She diagnosed me based on symptoms with a low tone pelvic floor dysfunction. She said it can cause all the same symptoms. Yeah, I think that that's absolutely possible. I mean, tight muscles are certainly far more common, but think about the women whose symptoms happen after having a baby. You know, where it's not necessarily tight muscles, it's very weak, stressed muscles that cannot do the job they're supposed to do. And sometimes muscles that get really stressed, I mean, they become so weak that you start developing a prolapse. So, I mean, I think that that's reasonable, but let's see what let's see if Isa Herrera mentions it. I'm curious. I'm very, 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 very curious here. All right. I don't see that in her index. Let's see. Let's see if it's in this one. Very interesting. Well, this book might be the better book for you. You know what? I think that this book would probably be more useful for you, Jennifer. Shotzi said, helped tremendously getting your estrogen levels up, helped your bladder heal. Yes. Carol says, I'm taking aloe vera capsules daily and it keeps the IC under control. Awesome. Good. Robin says, all women at a certain age need to have a test for hormone balance. Keeping these balanced will increase your sense of well-being and sex drive. I had fibro in my early 30s. Hormone replacement therapy had to be started at an early age. I completely agree with you, although I will tell you I had to fight with I had to ask 3 different gynecologists before one would agree to test my hormone levels. At a certain point in time, their answer, at least in Kaiser, is because I wanted an estrogen testosterone test, just because, again, I kept saying I want hard data. Give me facts here. I don't want you to guess. Give me facts. Do the test. I pay you a ton of money every month. Do a basic test for me. And the specialist finally agreed to do it. She goes, yeah, but it's not going to help me. It's not going to help me treat you. Joanne says she had 9 brilliant years post-op. Hi, Julie. Jennifer says, right, that's what she said. Your uterus is starting to prolapse. Even the gynecologist said she couldn't find any tight ones, and my hips are weak. So working on your core. Yeah, girl, there you go. Sherry says, what's a biofilm? So that's a really interesting question. Here, let me, you know me with my pelvic floor. I got to move around, my friends. And you know what's that rule is like never look at your face from below because you'll scare yourself. Yeah, isn't that the truth? All right, now come on now. There we go. So a biofilm. Okay, like I'm totally. Oh my God, I look awful today. You guys, I just look awful today. Just pretend you can't see my face right now. So biofilms are really, really interesting because you have to kind of ask yourself, how do bacteria survive? Are they lone guns? Do they run around in packs together? Do they exist together? All that sort of stuff like that. And it turns out biofilms are how bacteria live in a community and survive in a community. Thank you. Thank you very much. So biofilms are natural, normal populations of bacteria. And you can find biofilms at the bottom of lakes. You can find biofilms on dental equipment. You can find biofilms in pipes. You can find it. They're just everywhere. And so the question is are they normal or abnormal? And the answer is they're normal. This is a normal way the bacteria exist. The challenge with a biofilm is that they're very, very difficult to kill. They secrete this really nice, thick, waxy coating that is impervious to antibiotics. And so, unfortunately, when you're dealing with a big biofilm, that helps a little bit. When you're dealing with a biofilm based infection, then penetrating that and getting and breaking through that biofilm to the infection becomes much, much more difficult. Oh my goodness gracious. I hope that makes sense. Kind of, sort of. I'm a little wonky today, guys. I mean, honestly, I really am. Elaine says, trying to taper off Klonopin, lots of anxiety. Can you talk about how anxiety can affect the bladder? Yeah, sure. You know, I mean, whenever you're anxious, there is a biological consequence to that anxiety. Consequence number one is your body normally uses that anxiety as part of a fight or flight response. Your body is preparing to run or fight. And so blood flow changes, blood flow moves, blood flow goes from your core out to your legs and your arms because your body's saying, hey, there's a threat happening, it's going to fight. So we lose good blood flow in our core. It goes to the legs, it goes to the arms as a natural response to a major stressor. But the other thing that happens under stress is that there's a biological cascade reaction. And what we now know is that high periods of stress actually also cause the release of irritating neurotransmitters in the bladder. And so your bladder has the potential of becoming more and more irritated. It just is what it is. If you had to tell me, if I had to get on a plane tomorrow, I can absolutely tell you I would be up all night peeing and pooping because I would have an IC and IBS flare. That is exactly what my body does during periods of high stress. You guys are so good at supporting each other. Like, you don't even need me. You're so good at supporting each other. I'm so proud of you. And boy, if there was ever a day where we really need this, it's today. And I really hope that you can find some comfort today and not worry so much about our country and what's going on. We can't change the past. The future hasn't happened. What we've got to do is focus instead on today. What can we do today to be better? What can we do today to improve our health? And so for 15 minutes a day, I need you to do something to give yourself some comfort, physically, mentally, and emotionally. So do something for your spirit, whether it's taking a nice walk or going to church or whatever. Do something that will give you a lift spiritually. Then and then I want you to do something that will be supportive of your bladder and your pelvis. Whether it's following the right diet, whether it is having, instead of a coffee, this is not coffee, this is a pumpkin spice herbal tea that's very, very bladder friendly. Don't agonize over the future. You can take to the bank that your bladder is trying to heal right now, and your body is trying to heal. Your muscles are trying to heal. There's no doubt that healing process is at work. We just don't want to oppose it. We want to create an environment that will support healing. That means you've got to be diligent. It means you've got to do your stretching. If you've got pelvic floor, it means you've got to follow the diet. If you've got Hunter's lesions, it means that if anxiety is an issue, you've got to learn some good new anxiety management skills. I took an anxiety management class that completely and totally changed my life. I wish I'd taken it, 10 years earlier. It really would have changed my 20s. I took it when I was like 34. I had no idea that anxiety was ruling my life so much. And so doing something for that would be very, very smart. Carol says she's using aloe every day and it's helping. Awesome, awesome. All righty then. I think it's time for a giveaway. What do y'all think? Is it time to give something away? The question is what? What should we give away today? Any ideas? Anybody have something from the IC network that they would like to have? We can make as a giveaway, or how about some bladder rest? Would anybody like to try bladder rest, our option for Cysto Protect? Carmela says she's having pelvic pain after a bowel movement, even with an easy bowel movement, using squatty potty. Physical therapy made it worse. Carmela, listen, you got to understand, you guys, you cannot be afraid of pain with physical therapy. If you go to physical therapy and they touch a muscle and it triggers your pain, to me, that is really excellent news, because it means that they found the source of your pain. They found it. No more guessing. They found it. It is your piriformis muscle or your levator muscle or your psoas muscle or whatever. But what you've got to do, Carmela, is you've got to go back and say, okay, you can't push too hard on that anymore. Hi, Kate. Books, vitamins. Dawn says, what essential oils and natural help is there for urea plasma? That I don't know, hun. I don't know. I know that the essential oils that I use are going to be mints. I have a lot of mint essential oils. I've got some lavender essential oils. I've got lemon, orange essential oils. I love the scent of orange, and so I'll do that in my diffuser. But I don't have anything for ureaplasma. You know, you guys, if you've got a ureaplasma infection, then, you know, that's kind of a big deal. You really should have the next generation urine testing so that they can not only identify the ureaplasma specifically, but also identify if you have any drug resistance genes. That's really, really important. And again, there's no guessing there. They'll tell you if it's there. They'll tell you if you have any drug resistance genes, and most importantly, they will give you a list of the antibiotics that will kill that specific one. So Maribel wants to know the difference between, you know what, why don't we do this real quick? Let's talk about these for a moment so that you guys can understand the difference between these. And I can give you a little historical lesson. Let's see. Hold on a sec. Do I even have? All right. Okay. So supplements have been around for 25 years. And all we can say is thank God for that, because we now know that many of the medications used for IC have been linked to fairly serious adverse events. So many patients start first with supplements. And in fact, that's what the American Urology Association guidelines for IC tells you to do, is to start with supplements because they tend to have a lower risk of adverse event as compared to the typical oral medications. The first supplement that was ever created was Cysta-Q. We don't sell Cysta-Q anymore. It's still around, but its only active ingredient is quercetin. Quercetin has an antihistaminic effect. If you're in Canada, Cysta-Q is licensed as a therapy up there, and you can often get that at doctor's offices, but it's negligible. We really don't think it's that useful anymore. I have for at least 20 years. The second supplement that was created was Desert Harvest Aloe. This is a new label for Desert Harvest Aloe. It used to look like this, but they are rebranding. So many of you may remember this label. Okay, but this is what the new ones look like. Oops, there you go. Okay, so aloe has a coating effect, calming and soothing effect. What's interesting about this is that this company, this brand line was started by two sisters, one of whom has IC, and the other didn't, but they worked together, and they did a double-blind placebo-controlled study with their aloe. It was a very small study, under 10 people, but it did find good success in reducing the symptoms of IC. The sisters split, and they each went to different companies. One went to a company called Healthy Life Harvest, and another did Desert Harvest. Healthy Life Harvest is still around, but that sister is long involved. We don't even know who runs Healthy Life Harvest anymore. So the only aloe that we suggest is Desert Harvest Aloe if you want to try it. Now, of course, the challenge with aloe is that some people are aloe intolerant. It can cause gut issues. And so if you're one of those people where it gives you stomach ache, diarrhea, et cetera, this is probably not the medicine for you, or a supplement for you. The supplement, which really was a game changer for the IC world, was in fact Cystoprotec. Cystoprotec was invented by Dr. Theoharides at Tufts University, a federally funded IC researcher, almost 20 years ago. It has two methods of action. It has a bladder coating effect from chondroitin and hyaluronate, combined with the antihistaminic effect of the quercetin. So Cystoprotec was by far the top supplement for more than a decade, until until last spring when the new bottles came out with a cancer warning. And I don't know if you can see that. Warning. Oh, that's, my fingernails aren't dirty. That's blackberry. I've been doing blackberries. Cancer and reproductive harm. I don't know if you can see that right there. Of course, the veritable shit hit the fan when that happened, literally and figuratively, because the company, Mylan Consumer Health, which currently has the rights to sell this in the United States, has yet to issue a public statement about this. I have met with them twice now. They are giving very, very conflicting messages. I'm supposed to meet with them again this Thursday. But at this point in time, I have no idea really what's going on with Cistro Protect. I've got company people say they're not going to reformulate it, and others say they might reformulate it. Who the hell knows at this point in time? And it's really absolutely disgraceful. The reason why this has a cancer warning on it is because of the ingredient titanium dioxide. Titanium dioxide is FDA approved as a food coloring. It is a white food coloring. It is in sunscreen. It is in makeup. It is in candy, anything, toothpaste, anything that needs to be white. This is going to have, it's going to have titanium dioxide in it. What's weird with this, though, is that this is a brown capsule and a yellow ingredients. And so it's like, it's not white. So where's the white? It's very weird. Titanium dioxide has now been linked to cancer if you breathe it in. It's linked to lung cancer. It is FDA approved if you swallow it. However, new research now suggests that titanium dioxide has far more chilling effects throughout the body. So titanium dioxide as a coloring is now banned in France. It is in the process of being banned in the European Union. There is a move to ban it in the United States, even though it is FDA approved. So when people started getting their Cistro Protect with a cancer warning, they were like, oh, I'm not going to take something that says warning cancer or reproductive harm. And literally, I'm not going to take something that says warning cancer or reproductive harm. And I was a Cistro Protect customer myself. And so we were left high and dry. So what to do next? Cysto Renew came out about 5 years ago. It was created by Dr. Gio Espinosa at New York University. He's the head of their integrative urology department. And what he did is he basically took the active ingredients of this with the active ingredients of this and put them together in this. And so Cysto Renew, we had hoped would be the better supplement than Cistro Protect, but Cistro Protect continued to, kind of dominate over this one. Okay, but anyway, now that Cistro Protect is out of the water, or out of the picture, the question is, what do we do next? Ironically, I had been working for the last year with a new company, Natural Approach Nutrition, to create a new supplement line with the help of Dr. Ken Peters, who's the top IC researcher in the United States. So it's been this a year-long discussion of formulas. What do we want to try to do with the supplement, et cetera, et cetera. And that yielded an exciting product called Bladder Builder. Bladder Builder is now being used by 800 or 900 patients. We're very, very happy with it. This is a very, very robust formula. So it has the chondroitin and the hyaluronate from the Cistro Protect. It's got the quercetin, but it also has some collagen in it. It has some probiotics in it, but most importantly, it has PEA in it. PEA, palmitoethanolamide, has been found in research studies to reduce pain. So Bladder Builder is a very, very robust formula. And for those who used it, the first batch was 5 pills a day, but they reformulated it to 4 pills a day so that people didn't have to stop in the middle of the day. But it's the exact same thing, exact same thing. Okay, so if you're somebody who you don't mind taking new things, you don't worry about side effects, you're not particularly prone to side effects, you're pretty bold with what you'll do, this would be the one to start with. But if you're like me, you're really, really sensitive and you're kind of scared about trying new things, we would suggest instead that you try Bladder Rest. So made by the same company. And so this is an interesting story. When the cancer warning came out on this, and I was flailing for answers and resources because we stopped selling it. Natural Approach Nutrition came to me and said, we can create you an alternative for Cystoprotect. Almost exactly the same ingredients, but without the titanium dioxide. And they did. It's actually a stronger formula than Cystoprotect. This is a stronger smaller bottle, stronger formula. This has more of the chondroitin, more of the hyaluronic, more of the quercetin. And instead of being in an olive kernel oil base, which makes it very heat intolerant, this is in an avocado oil base. There's no PEA in it. So this is really the bladder coating. This is kind of the equivalent of Cystoprotect. Okay. But the most exciting one is the newest one, which is Peora. And Peora is a match for the ICPEA research study that was released in May. So researchers in Italy were trying, they were trying to determine just how useful palmitoethanolamide could be in reducing the pain of IC. And their research study was nothing short of spectacular, because what it showed is that 6 months, 100% of patients using PEA had a significant reduction of their pain, and 25% were pain-free with no reported side effects. PEA is over-the-counter. It's been in Europe for a decade or longer. It's been very difficult to bring here into the United States. But what makes this different is it's not just PEA, it's resveratrol. And it's the combination of the two. It's not the PEA alone. Some of you have just done the PEA and not felt as good. But if you do the PEA resveratrol, which is in the formula in the research study, that is considered a better combination. And so Peora is, I think, the most exciting supplement, because it's a supplement that might help reduce pain. And it also happens to be the cheapest of all the supplements. It's just $29. And so that's pretty cool. So again, if you're super sensitive and you don't like to try a lot of new things, you're cautious about doing things, you want a simple formula. And if you're a pain patient, you could just do this, which just has a couple of ingredients in it. Or you could do the Bladder Rest, which has bladder coatings in it as well. This does not have any bladder coating in it. This is just to try to reduce pain. But if you're bold and you want to try a really good formula, then Bladder Builder would be the one to go to, because this is the one that supports whole body health. And again, this was a year-long project. Donna over on YouTube says that she's getting good results with the Peora. Kay says she's getting good results with the PEA and the Bladder Builder. Kay says it helps with your pain that you have in your whole body. And that's what's so neat with the PEA, is that it has been studied with many, many pain conditions: lower back pain, fibromyalgia, burning mouth syndrome, IC. And this PEA over and over and over is getting really good results for reducing pain with very, very few side effects, at least reported in the studies that I've seen. I think only one PEA study had side effects that I remember, and it was some stomach side effects. So anybody here using any of these right now? I'd love to hear what you think of them. Ravonda says, can you explain preservative-free hormone? Mine contains hormone, glycerin, and emollient cream base. Really, Ravonda, it's just about avoiding the extra preservatives that are in brand names. If you're getting Premarin or Estrase, because it's a brand name, those packaging, I mean, it's like, to make a very, very poor example, it's like the difference between a loaf of fresh bread that you've made versus a Twinkie. Twinkies are meant to have a long, long shelf life. So they're just filled with preservatives. Whereas your homemade bread, you know, if you don't eat it in a couple of days, it's going to go bad because it's fresh and healthy. A medication is the same way. There are medications that are compounded and made for use in a very rapid period of time, and there are medications that are formulated to have a long, long shelf life. And Premarin and estrace are ones that are formulated for a longer shelf life. So they tend to have more preservatives, which can be more irritating to our bodies. So I see patients tend to do better, especially if you're sensitive, with a preservative-free formula instead. Julie said the hospital where my doctor was part of Philadelphia Hahnemann, and I had to go to the ER, and they told me you had a very bad kidney infection and 2 large bladder stones and several smaller ones. Have you ever heard of this? I was in the hospital for 4 days, sent home with strong antibiotics, which I have to finish before they remove them. Absolutely, Julie. Absolutely. And the thing is that having those antibiotics are going to be really, really important to you because number one, we got to treat that kidney infection aggressively. We don't want that kidney to become badly damaged since it's central to your life. But number two, kidney stones and bladder stones are covered with bacteria. And so it only makes sense that they would want to try to knock down as much of that infection as they can before they try to get them out of you. And normally what they would do is try to break them up so that you can get them out naturally rather than do surgery. But sometimes they've got to do surgery. Hi, Erin. Hi, Shirley. Robin says, pyridium was also a cancer cause. Wow. In the past, I've taken tons of that red urine-making pill. Also ruined many panties and toilet bowls. You started taking the blue Urabel. There were rumors about the FDA pulling Urabel. I have seen no evidence of that yet. No. Connie says, ladies, I was diagnosed in 2004 with IC. 36 years, suffered for a year hard, went totally herbal by building up my immune system. Oh, girl, you have to say the S word. I'm really glad that you're doing really well. So, you know, Connie is raising an important point. What she did is she went totally herbal. She used some colloidal silver. She changed her diet. She got rid of sugar. She got rid of any of the extra chemicals that can provoke the body. And within a year, she's functioning well with no flare-ups. So, you know, guys, I see as a wake-up call. It forces you to look at your daily life. It forces you to look at your diet. It forces you to make changes that for many of you probably should have changed, you know, in your 20s. It's amazing how we can cling to old habits, even though we know that they're damaging. And so just changing your diet and removing the sugar is huge in terms of reducing inflammation in the body. And so, Connie, I'm really glad you used that. The only thing that I completely disagree with is the colloidal silver, because colloidal silver has no functional role in the human body. Putting a heavy metal into the body is extremely controversial, but colloidal silver has, according to the FDA, one of the most dangerous over-the-counter products out there, and we certainly don't recommend it. But it has its own fan base, that's for sure. Not criticizing you for it, we're just letting people know there are pros and cons. Catherine says, does bladder builder help Hunner's lesions? Like Hunner's lesions keep coming back after they are cauterized. You know, Catherine, Hunner's lesions have now been linked to viral infections in some patients. So we know that some patients with recurring Hunner's lesions are actually having recurring viral infections from the Epstein-Barr virus or from the polyoma BK virus. So there's nothing in this that would do that I know would defeat a viral infection. But in terms of overall bladder health and maybe improving your bladder's health a bit, it might be helpful, but I certainly can't say that. I don't know of anybody who would say that any supplement out there can heal a Hunner's lesion. Maribel says she's taking Bladder Bill and Piora. Should you add the other one? No, you don't need to add the other one. Erin is using Bladder Builder. You liked it. You started slow. Guess it's time to increase. Robin said, Robin has burning mouth syndrome. It comes and goes. Which one do you recommend for this? Peora, because there's actually a research study with palmitoethanolamide and burning mouth syndrome. So that would be the one for you. Hello, Thomas. Thomas says, I've had IC for 12 years. Last week, I underwent yet another bladder distension with Hunter's disease treatment. I'm now taking Cipro for a post-op infection. Oh, I'm glad it's behind you, hon. What did they find in your bladder? Did you have your more Hunter's lesions treated? What'd they find? So Thomas, I don't know if you know this or not. Your Hunter's ulcers were ablated. So okay, excellent. So Thomas, I don't know if you know about the research which has found a couple of viruses in the urine of patients with Hunter's lesions. Have you ever had mononucleosis or Epstein-Barr? Okay, okay. How many lesions did you have? Or ulcers? Hunter's ulcer, Hunter's lesion is the same thing, people. Do you know how many you had? How many they treated? Holy crap, you had 20? Woo, baby. That, my friend, that's a lot of lesions. I'm so sorry. He said very painful. So Thomas, as I was explaining earlier, we're kind of at another really interesting crossroads in the IC world. We're at a crossroads with respect to the role of infection. And okay, I got to sit down again. Sorry, guys. Oh, hold on a sec. Got to go under my desk for a moment. Now I'm going to sit on my yoga ball. This is what happens when you have piriformis syndrome, my friends, is you are constantly sitting on different things, as I am. I would be happy to call you Tom. My nephew's named Tom. That's a wonderful name. All right. So, you have to remember, Tom, that 20, 25 years ago, we were all talking about IC as, quote, an incurable bladder disease. And the perception was that maybe it was some sort of fastidious bacterial infection, an infection that's difficult to find, an infection that's difficult to culture. And this debate and discussion continues to has happened for 20 years, and it's kind of resurging now. But now our eyes have been opened to not just look at bacteria, but to look at fungi. So it was our own National Institutes of Health who discovered that many patients having flares actually have bacterial infection. Fungal infection. That flare was a result of an overgrowth of candida in their bladder. And of course, an antibiotic would do absolutely nothing for a candida infection, if not make it worse by killing the good bacteria. But it was researchers in Europe who started making some very interesting viral discoveries. The first research study found that the polyoma BK virus, now polyoma BK is a virus we all have. It is a natural part of the human urinary biome. It is a virus that is normally silent. However, it does get turned on in patients who are immune compromised. And so if you go to the National Library of Medicine and you Google polyoma BK virus in the medicine, you will see that it's associated with hemorrhagic cystitis. So we see that outbreak of that virus in the form of bleeding lesions in patients who have had, who are on anti-rejection drugs, things like that would really make that patient immune compromised. So that was very, very interesting. And then we had another research study that was presented last year at the American Urology Association, which also made that same finding with the Epstein-Barr virus. And of course, Epstein-Barr is associated with mononucleosis. And what's interesting is quite a few of the patients that I've been talking to since then who have lesions, I asked them, have you had mono? And they say, yes, they have. So the question then becomes, what does the mainstream IC community think of these viral findings? And they're a little bit vague. I mean, we can't deny the study. The studies were good enough to be accepted at the American Urology Association. I emailed one of my contacts over in Europe, because if you look at the European guidelines for IC, they very specifically say that patients should be screened for viral infections. And so I asked her, I said, okay, you screen for them. What do you do if you find a viral infection in an IC patient? And their answer was, we don't really know. How would you know if you had mono? So mononucleosis is a kissing disease. It's really where you're sick for weeks and weeks and weeks, extreme fatigue, and it eventually passes. It's highly contagious. It's very common in high school, and you often see it in boyfriends and girlfriends because it's shared by kissing. So what I'm going to say now is not supported by any urology group at the moment, any urology association at the moment, because we're just at the beginning of understanding the potential role of viral infection. You could have a different type of next generation urine test to see if you had a viral infection, and it's not Microgen, it's another company. Hold on a sec. Let me see if I can give you the name of them. And you could, let me see if I can find it here. It's called Bacteriomics. I'm typing it in your chat. So they do testing to identify bacteria, fungi, and viruses. And again, I like data. I don't like guessing. I like hard facts, right? And to me, testing gives you hard facts. If you got 20 lesions, if you had 20 and you've had recurring lesions for some times, we kind of want to understand why these lesions keep recurring, why you're so vulnerable to these lesions. And so it would be, in my opinion, fascinating to have a next-gen screen of your urine, not only for bacteria, but also for fungi and also for viruses. That would be interesting. And then it would be, if they did find a virus, like Epstein-Barr, then you're probably going to have to explore therapies, that antiviral therapy of some type. We'd have to leave that to you and your doctor. All I can say is, no, Cipro would not clear it up, hon. Cipro is an antibacterial. It's not an antiviral. But we don't know. I mean, you can't guess. What do I keep saying over and over and over again is, people, please don't guess. Don't guess. Don't self-medicate, because you could go in the wrong direction. We need facts first. You know, the reason why I did the next-gen test 2 months ago is I was absolutely convinced I had yeast. And the test came back no yeast. And I believe those results. I absolutely believe those results. If I had Candida, that next-gen test would have found that. And so there you go. There has to be a reason why you keep getting lesions, hon. There has to be a reason. Could it be viral? The Europeans say it could be. The Americans haven't really come. The American IC community has not made any formal statements that I'm aware of about the role of viruses in lesions. But if I were you, if it were me, and if I were continuing to get recurring lesions over and over and over again, it would be something that I would want to have done. I would want personally to invest that money in having that test just out of curiosity. Because I think you're worth it, and because I'm worth it. If I'm in pain, I want to know why I'm in pain. I want eyeballs on the organ. I want somebody to look. You've had somebody look. They found lesions. Now we want to try to figure out why you're so prone to lesions. And if there's any chance that it's a virus, if there's any chance that an antiviral might help, I think that that's worth considering. I don't know if US IC doctors would agree with me, though. I don't. The Europeans would. I don't know if the US would. We haven't really talked about it. We've been talking about doing a conference more, bringing together some stakeholders and doing a big science conference for IC. We might. Stephanie says, where can patients get the medications, the lidocaine, marcaine, and sodium bicarb for self-installation? My specialist is a few hours away in another state, and her pharmacy cannot ship across state lines. I'm not finding a local pharmacy that has what I need. You'll probably have to find a compounding pharmacy in a big city in your state. And just know that lidocaine has been in short supply. The lidocaine gel to numb your urethra, I think, has been discontinued. And there was a shortage on heparin for a while. So patients who do home instills are having to really work for it. Or you can buy a pre-packaged Hep-Lido-A installation where you don't have to put anything together. You're just getting Hep-Lido-A. I'll put it in chat. They can order that from the manufacturer, and you won't have to assemble the ingredients yourself. You would just buy the product directly. Imprimis Pharmaceuticals, a compounding pharmacy, had their licensing rights for that, but they gave it up 2 years ago. And now pharmacies across the United States can buy Hep-Lido-A. It's also known as the Parsons installation, pre-packaged, so you don't have to buy the individual ingredients. Where are the best IC doctors located? There are 3 top-tier doctors that I think are the best in the United States. You've got Robert Evans at Wake Forest in North Carolina. He's been voted the IC Doctor of the Year for the last 5 years in a row. You've got Ken Peters at Beaumont Urology in Royal Oak, Michigan. And you've got Robert Moldwin out on Long Island. Those are the top 3 in the United States. If you're out on the West Coast, you've got Christopher Payne, who used to be at Stanford. He is now at Vista Urology in San Jose, California. You've got Phil Hanno at Stanford. So that's really the top tier. JJ, what state are you in? Aaron says, I suffer from major lower back pain all the time. Is that because my muscles and nerves are in overdrive? Yeah, maybe. It could be. But it could be something else, like, maybe some arthritis in your spine, maybe some hip dysplasia, something going on with that. I mean, I think it'd be very important for you, Aaron, to go see an orthopedic surgeon and have them look at your lower spine and your back. Pelvic floor dysfunction is often driven by bony dysfunction, having a hip that's out of place or a sacrum that's out of place or a broken tailbone. It'd be very interesting for them to look at your lower spine, maybe have an x-ray, see if they can see any intrusions around L4, L5, which is the area which does the bladder. Aaron says, how do you get a doctor to believe that there can be bacteria deep in a biofilm? Every doctor should know that there are bacteria living in biofilms. The real question, Aaron, you're not asking the right question. The question is, how can you get a doctor to believe that there's a fastidious infection deep in your bladder? And it's hard. It's hard. This is the reckoning that we're going through right now, is that we're now seeing the typical urine testing is giving false data. that typical urine testing, a urine culture, does not grow out the vast majority of bacteria that can live in our bladder. So everybody is agreeing at the research level that next generation testing is much better. And in fact, let's see. I think in our summer magazine, let's see here. They had a new study. Here you go. Next generation urine testing can help treat recurring UTIs. And so it said some IC patients struggle with recurring UTIs, which certainly exacerbate their bladder symptoms. Being able to treat these infections effectively is important. For years, urologists have done cultures of urine to determine what bacteria had infected the bladder and then treat it with correct antibiotics. Recently, though, a more thorough urine test, next-generation sequencing, has been developed. Researchers from Florida and the United Kingdom did a study to compare next-generation sequencing with traditional urine cultures. They found that next-generation sequencing identified significantly more types of bacteria. In fact, it identified almost too much bacteria when compared to a standard culture, which could also present challenges for treatment. Next-generation sequencing isn't recommended for acute UTIs, but only for recurring ones. So you got that article in here, Erin? Here, let me turn off. Now it's too cold in my office. JJ, I was on the IC site 20 years plus. All they knew then were opioids. I would tell anyone never get on opioids every day for a long period. Ravonda says, with Peora, I noticed that under other ingredients that included tapioca flour. Is this in the capsule or inside the ingredients? It's in the ingredients, hon, because the tapioca flour is what's getting it through the machinery so that they can feed it into the capsule. I'm sorry. They always have to have some sort of ingredient in there that will help it pass through the machinery. And so rather than using, what was the other one that they were going to use? Rice flour. Some people are allergic to rice. They decided to go with tapioca flour because there are far fewer people are allergic to tapioca. I'm sorry. Carmela says, I'm deficient in Carmela, do you mean B12 or B2? I'm deficient in B2, but can't tolerate the supplement. It flares you big time. So Carmela, if you're trying to take a B complex, it's because of the B6. So B12 is absolutely fine for IC. All the other supplements, B vitamins are usually fine, except for B6. B12 should not be a problem at all. I don't know if you just meant B2 or B12 in your question, hon. Nicole says, is there any research? Okay, so Carmela, again, B2 shouldn't be a problem, but is it just B2 or is there something else in it? Is it a B complex? Nicole says, is there any research connecting the use of Cipro causing IC? I think Cipro caused mast cell activation for me and I got IC. I had anaphylaxis after 4 days of Cipro, went to the ER, had an EpiPen. That was December 2016, and since then I have to take an antihistamine every day. So, Nicole, we did an article on Cipro. I think it's in here. Yeah, here it is. This is our winter, the dangers of Cipro and levofloxacin. You could tell I was picking berries. My fingernails are turning blue. Okay, so let's just go to this for a moment. So here's the article, The Dangers of Cipro. Have you been floxed? That's what they call it. Let's see. When we are prescribed an antibiotic, we are under the assumption that the antibiotic is going to kill and only kill bacteria that might be causing the infection. But what if the antibiotic also kills human cells, cells that are imperative to our life and our body functions? Researchers now believe that is exactly what is happening when a patient suffers a severe side effect taking a fluoroquinolone antibiotic such as Cipro. This type of antibiotic appears to damage mitochondria, an essential structure in the cells throughout the human body that turns sugars, fats, and proteins into chemical energy that allows us to function. So it was prescribed more than 32 million times in the United States in 2015. It's caused tens of thousands of devastating side effects, including diarrhea, vomiting, tendon ruptures, joint, muscle, nerve conditions, retinal detachment, aortic aneurysm, central nervous system dysfunction, insomnia, restlessness, fatigue, seizures, convulsions, psychoses, and more. Some patients have developed hemolytic uremic syndrome, a condition that affects blood and blood vessels, resulting in the destruction of blood platelets, anemia, and kidney failure. It can cause Stevens-Johnson syndrome, which is a skin condition. It can also cause the skin and mucous membranes to become necrotic and die. A very small group of young, healthy females have developed fluoroquinolone disability syndrome, where they become permanently disabled after using the medication for minor medical conditions. And I will say that for the last 10 years, the FDA has been issuing warning after warning after warning about Cipro. It is no longer suggested for anybody with simple UTIs. They believe the risks of using Cipro, Levaquin, and other fluoroquinolone medications far outweigh the benefits. So they're not recommending that it be used for acute sinusitis, acute bronchitis, uncomplicated UTI, etc. Fluoroquinolone should only be reserved for those who do not have alternative treatment options. FDA alerts in 2008, 2013, 2016, 2018. Lots of alerts here. So Nicole, I would dive into the research. You can get this magazine in our store. I think just go over to the ICN shop. You can buy it by email, instant download. Or if you email me, I'll send it to you, not a problem. My email is icnetwork@mac.com, icnetwork@mac.com. JJ says, hydroxyzine drags you out so badly. What does it do for IC? Hydroxyzine is an antihistamine, and it helps to reduce some of the mast cell-induced irritation and inflammation in the bladder. So think about it this way. Where's my picture here? Where did it go? Where did it go? One of the ways that we describe IC for some people is it's like 1,000 mosquito bites at once in the bladder, or 100 mosquito bites at once in the bladder. So if you have estrogen atrophy and urine, you don't have that nice thick protective coating anymore, and urine can penetrate through to your skin. It bypasses the mucus because there's not a lot of mucus there. Your body's going to react to the presence of whatever irritant is in there. And what happens is mast cells release histamine. And that's what happens when you get bitten by a mosquito. The mosquito, to suck your blood, it puts in some venom with an anticoagulant in there. And your body goes, hey, that doesn't belong there. And you have this profound reaction, the redness, the swelling, the irritation. That's really histamine driven. The mast cells release histamine. So using an antihistamine to calm that is important. And in fact, I have a good diagram that I can show you about this. Is it in this one? It should be in this one. Yeah, here it is. So this is kind of the operational diagram that has been used by the top US clinicians now for the last 15 years. And I don't know if you can see this. So basically what they're saying here, hold on, I got to see this too. Okay, here we go. Is that there's some sort of bladder insult. Something damages the bladder wall. So you get epithelial damage. And then you get a leak into the urothelium, into the bladder wall. They say potassium leak, but it's whatever's in your urine. What happens is that this activates nerves, causes nerves to release substance P. That irritates the tissues and causes mast cells to release histamine. So you can see here, tricyclic therapy, the low-dose antidepressant to calm the nerves down, and then antihistaminic therapy to calm the mast cells down. I can't do screen share, unfortunately, until we move over to Twitch, and I just haven't had time to set it up. So when I can do screen shares, it'll be a lot easier to see these diagrams, and I'll be able to explain them more. Sherry says she's used opiate medications for over 8 years, and it helps you function. And, you know, I mean, I chaired our State of California Pain Conference years ago that led to our governor signing the Pain Patients Bill of Rights here in California. And the distinguishing factor is, why are you taking pain meds? If you're taking pain meds to escape life and to escape your responsibility, then you're an addict. If you're taking pain meds so that you can function, so that you can do the things that you need to do, then you're using pain meds appropriately. And then it really becomes a question of finding the right dosage that is low enough so that you're not struggling with adverse events, but also able to deal with some of the pain. More is not better when it comes to pain meds, that's for sure. Meg says, urinalysis has always been negative, went to urgent care due to increased urgency and frequency. Urinalysis was negative, but the doctor prescribed Bactrim in case the culture returned positive. No surprise it was negative, so the doctor stated not to do the Bactrim. Well, I took one Bactrim. Months later, I'm trying to understand why did your estrogen decrease? Why did your symptoms decrease? My urologist always stated no infection, no antibiotic. Well, hon, that's part of the antibiotic stewardship rules now that hospitals and clinics are using, because drug resistance, antibiotic resistance is such a severe problem. Is they're creating really hard and fast rules about when they will prescribe antibiotics and when they will not. And what they're saying is they're not going to prescribe antibiotics with a negative culture, which of course is kind of, I mean, this is how I started our meeting today, as we were talking about this, that, you know, we're kind of stuck between two conflicting sides. We've got the side who says that negative cultures mean no antibiotics, and we've got the side that says, hey, if that patient has a negative culture, but they feel better on antibiotics and they've got pus in their urine, then maybe they do have infection. And until there's been a lot of discussion about rewriting guidelines, and I think that needs to be done, we don't have consensus right now on what to do in this situation. There's considerable debate, hostile, aggressive debate going on right now at the top circles in urology, not just IC, but urology in general. I would suggest that it would be very interesting for you to go over to Twitter and search for, you can go to my Twitter feed, which is, I use more than Facebook now, ICN Jill. And then from there, you'll be able to find a link to Dr. James Malone Lee, who is leading the crusade about how to not walking away from patients who respond to antibiotics just because their culture is negative. What they're saying is that the testing itself is flawed, and I think we all agree the testing is flawed. Carmela says, "Oh my God," or "Oh my gosh, I was floxed from Levaquin and wound up in the ER 16 years ago. I was so sick and didn't know what it was. You were sick for weeks." Yeah. Melinda says, "If you can't use Cipro, what do you use?" Huh, there are tons of other antibiotics available. And when you do the next generation test, they give you a list of all the antibiotics. So you've got the cyclines, the tetracyclines, you've got the penicillins. I mean, there are the cephalosporins. There are lots of other types of antibiotics that might be useful. Let me find my test results and I can show that to you. Hold on. All right, now they were just here. Here they are. All right. Boy, is this the wrong sundress to wear? The sleeves keep falling off. All right, so this was a next generation test I had done from Microgen. There are a couple of different companies, Periomics, Microgen. Microgen does not test for viruses. The other company, Periomics, does. And so I don't know if you can see this, but so here's the bacteria they found: Lactobacillus, Prevotella, Streptococcus, and Gardnerella with the percentages. And then they show which antibiotic will kill which specific infection. And so in this one, penicillins would kill the Lactobacillus and the strep, but not the Prevotella and the Gardnerella. Let's see. Flagyl would kill the Prevotella and the Gardnerella, but not the other two. Yeah, I mean, so guessing isn't working anymore. That's kind of one of the criticisms here that has happened really in the last 20 years with antibiotic use is that a lot of us, myself included, we call our doctor. Before we were diagnosed with IC, we called our doctor, said we thought we had infection, and they just prescribed a broad spectrum antibiotic over the phone, guessing that we had infection. And there is a very strong belief that is what is that guessing has driven a lot of the antibiotic resistance that we've seen in the world. I mean, it's terrible what's happening with antibiotic resistance. Antibiotics have to be, there needs to be good stewardship. And that's hard when in some countries they're over the counter. As an example, India has the highest rate of antibiotic resistance in the world because they're over the counter. And oh gosh, I was just watching like a 60-minute show or something about it's terrible that even there are some bacteria that are resistant to all but vancomycin or these top tier, like there's only one antibiotic that can kill them. And they're now finding that in the general population because of the overuse of antibiotics. So we got to be really careful with our antibiotic use. Carol says, "Hi, Jill. I'm having a flare now. It sucks. I was tested for UTI, but I don't have the results yet. So what can I do to feel better to get the results? You've been taking azo, but they say you're not supposed to take it very long. Do you know why that is?" Yeah, because azo can be linked to kidney damage and I think some liver damage. So you got to be careful. Azopyridium is not meant to be used for long term. It's meant to be used for short term. Usually, ideally, just a couple of days, although there are patients who have used it for months and months, and they argue that should not be done. Whenever we work with flares, we always want to try to figure out what kind of flare you're having. When is your pain the worst? Before you pee or after you're done peeing? That's the first thing. Before we can talk about treatments, we got to try to figure out what kind of flare that you're having. Is it a bladder wall flare or a pelvic floor flare or a hormone flare? So the first question is, when is your pain the worst? Before you pee or after you're done peeing? Joanne asked, would next generation sequencing be useful with your recurring UTIs? Absolutely, hon. Absolutely, because you can have kidney infections. You could have an infection in your stoma. So yes, and any good infectious disease specialist is using them now. Kylie says ciprofloxacin saved you. Ciprofloxacin, there's no doubt it's a good antibiotic, but it can also kill you, and you have to be careful. It can cause aortic aneurysm. There are many, many problems with Cipro. So it has been reclassified as a more dangerous medication. It is not meant to be used for simple infections anymore. Hi, Karen. Hi, Kathy. Maribel said she was taking Visceral but stopped because it was making you gain weight. Okay. What I didn't gain any weight with hydroxyzine. I gained weight with Elavil. But you know what? We're all different. We all process our medicine differently. I believe you. Hi, Christine. Aaron says, so why can't they send your urine through an alternative route so that your bladder has a chance to heal? They can. It's called urinary diversion. They can do that. They just, what they'll do is they'll temporarily detach your ureters from your kidneys and send it over to your skin to a stoma. And so if somebody has a gunshot wound, something like that, they sometimes have to do that. And then you give it a couple weeks or a couple months for things to heal, and then you reattach. It's called urinary diversion. Robin says the old urine test should be out and replaced with microgen testing. It's a huge problem. Also, when a patient goes septic and dies, do they always test for microgen first or last? It's all about the budget at the hospital, for sure. I agree with you. Listen, the old way of urine culturing is going to be out sooner rather than later, unless they develop some sort of amazing growth medium. The reality is that next generation testing finds more, and it can identify bacterial, fungal, or viral. And the biggest challenge now is how to interpret the results. And interpreting the results is dependent on understanding your biome, because the next generation test will show everything. It will show your good bacteria, like mine did. It showed lactobacillus, that's good bacteria. It will show bad bacteria, like mine did, Gardnerella and Prevotella. Those are bad bacteria. So how to interpret them is the challenge now. Kathy says, if you only have frequency and urgency, should you have a hydrogystension? Hydrogystensions are used when the diagnosis is in doubt. That's what the American Urology Association says. So if your doctor simply does not understand what's happening, if your doctor is confused, if your doctor thinks that there's some other warning signs like visible blood in your urine, then that's when a low pressure, short duration hydrogystension would be done. It's no longer required for a diagnosis of IC. However, it is recommended if the doctor is confused and doesn't quite understand why you're struggling to the degree that you are. My position on hydrogystension is one of going back to what I keep saying. I like facts. If I'm in pain or I'm bleeding and it's not getting better, it's getting worse, I want somebody to look at it. I want eyeballs on the organ. I want somebody to tell me why I'm bleeding. And that was what led to the discovery of early uterine cancer for me 2 years ago. And I broke my own rule. I waited 6 months. And I'm very lucky that we caught it when we did. And so in your case, I think you have to ask yourself, are you getting worse? Are you not responding to therapy? Is your doctor concerned about something else? I want to give you a story of a patient that I worked with that I thought was really, really important. This was a patient who was afraid of having any testing done. And she had frequency, urgency, pressure pain, but she wouldn't let the doctor do anything for years, for a couple of years. And then finally it got so bad, she said, okay, you can do a cystoscopy in the office. And a cystoscopy is what I call a looky-loo. It's just a quick test, 5 minutes. They numb your urethra, stick a scope in, take a look around, pull it out, you're done. When they did her cystoscopy, what they found was a giant kidney stone. And that kidney stones are very sharp and they're covered with bacteria. So literally she'd had this sharp kidney stone floating around in her urine, cutting her bladder wall for years. And when they broke up the kidney stone and they got it out of her, her symptoms healed. I mean, her bladder healed, her symptoms went away. So in her case, not letting the doctor do a cystoscopy when she was first diagnosed led to years of pain. And her treatment was remarkably easy. So I'm not afraid of having it done, but I think it's important that you talk about methodology, how they choose to do it. In the old days, they used to do them high pressure, long duration. So what does that mean is, so here's your bladder, and you remember your bladder's like your stomach. It's a hollow organ, and it will fill up, and then it will contract. It will fill up, and then it will contract. The worst thing you can do to a hollow organ like your stomach or your bladder is to fill it up and then to push it. And you know that when your stomach gets really full, it hurts. Well, when your bladder gets really full, it hurts. So they always do a hydrodistension in the OR under anesthesia as an outpatient procedure. So in the old days, they would really stretch it, high pressure, and then they would keep the fluid in there for a longer period of time, long duration, high pressure, long duration. But when the American Urology Association released their guidelines in 2011 and then revised them in 2014, they said no more. That is too traumatic. That can lead to bladder rupture. Now they do low pressure, short duration. They just stretch it a little bit and take a look. And I had one 2 years ago myself, and it was piece of cake. So if you would rather them look, then hydrodistension is viable, but you need to ask them how they intend to do it. And low pressure, short duration, that's the way to go. Again, guessing gets us nowhere. If you're not getting better, the guesses aren't working. There's a time and place for taking a look. Rebecca says, some of my friends who have chronic UTIs are being treated by antibiotics which are shown to be resistant in broth tests and microgen tests. That's a tremendous tragedy, Rebecca. This is an absolute waste for them to do that, and it's harming them because it's killing off the good bacteria, and it's creating the perfect environment for the drug-resistant bacteria to flourish. They should know better, and their doctor should know better. That makes no sense. Sherry says, I'm allergic to penicillin, so Cipro was the go-to antibiotic for you for the longest time. Now what would you do? You have to talk to your doctor, hon. There are lots of different types of antibiotics. How do you get the next generation testing? You can go to bladderhealth.org. And I built a website for it a year ago to explain it. Bladderhealth.org. And there are a bunch of videos over there of urologists who are using it, explaining how they're using it. And then you can just order it there. You can just click on the order link if you want to do it. What does a cystoscopy with a hydrodistension done with gravity mean? That they all use gravity. it's a pressure situation. So there is a IV. There's an IV pole with a solution on it, and the tubing is connected through a catheter into your bladder, and it's all about the positioning of the IV bag to determine the pressure. That's just how they keep fluid in there. It's just a pressure thing. I'm not explaining that well, but it is. Robin says, I was in pain for 4 years. I searched and found a women's specialist who treated IC. My urologist wanted nothing to do with the microgen test. We talked for 45 minutes. For at least 45 minutes. I must say he helped me with all the other options. He placed me in a research group. I took proof of at least 50 women who had found relief. My primary care physician also believed in microgen testing. I was blessed. Ask the nurses of these doctors if the physician treats IC patients. Wishing you to find. My doctor learned alongside me. Okay. Thank you. So Joanne here, she said she had great relief from her first hydro, but unfortunately their bladder wall ripped during the second. Yeah. See, that's why we don't do high pressure long duration, because the bladder wall can be torn and can rupture, especially if you've got Hunner's lesions, because those are very thin spots on the bladder wall. Hi, Louane. Low pressure, my friends. Remember, hey guys, you pay them, they don't pay you. You're the boss. It's your body. You get to decide what is done to your body. And if they're not willing to explain what they're doing, if they're not willing to engage in a dialogue with you about the pros and cons of whatever therapy they're considering, then that is a big giant warning sign to me. You should never, ever, 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 ever allow anyone to put a treatment in you and not tell you what it is first and give you fully informed consent. You know, we have a doctor who does this occasionally at the very first appointment, and his nurse does it, where she'll tell the patient they need to get a clean catch urine. And the patient's like, sure, go ahead and do it. And then before you know it, that nurse has put something in that patient's bladder, and without letting that patient know what she was doing. And that is the height of malpractice, in my opinion. Informed consent is there for a reason. You should know everything that's being done to your body before it is done. You should have the right to talk about it, talk about the risks, the benefits, the pros and cons, and how they propose to do it and what methods they're going to use. You know, you pay them. They don't pay you. You are the boss in the long run. You got to take your power back. Melinda, I just got diagnosed a few months ago. How do I know it is that and not something else like cancer? Well, you know, Melinda, it's when you're diagnosed with IC, you are engaged in a journey of solving the mystery of your pain. We have to try to figure out what is triggering your pain and symptoms. So it could be your bladder wall. Your bladder, like any other part of your body, can be injured. It could be estrogen atrophy. It could be chemical irritation from drinking too much soda or taking a medication that's irritated your bladder, or chemotherapy. It could be a chronic infection of some type, bacterial, fungal, or viral. But that's the smaller group of patients. The bigger group of patients is believed to be people with muscle injuries. We see far more muscle injuries, pelvic floor injuries. So if your symptoms began after having a baby, a car accident, a fall, a rape, if your history of athletics, if you've fallen multiple times, if you've fallen on your tailbone, if you were a bike rider, anything that puts pressure on your pelvis and your pelvic floor could trigger pelvic floor dysfunction. And what happens then is your muscles get so tight, they restrict blood flow to your bladder, and then your bladder cannot be healthy because it doesn't have good nourishment, because it doesn't have enough blood. And so hopefully, as they did your diagnostic review, you had a proper pelvic floor assessment. Then it is perfectly reasonable to talk to your OBGYN about fibroids. If you've got really painful periods, if you bleed profusely during your periods, you want to get yourself screened for fibroids or endometriosis because we know that those two can cause symptoms of IC. We also know, as an example, that some patients have something called Tarlov cysts, little tiny cysts of spinal fluid right off of the spinal cord, right down by L4, L5, which innervates the bladder. So that could be a source of pain. So you're really going to be on a fairly long journey of ruling stuff out until we try to find what your unique case is. Now, one of the things you really want to pay attention to, though, is blood in your urine. If you've got blood in your urine, either microscopic or visual blood in your urine, then that tells us we've got to focus on the urinary tract rather than muscles and nerves. Also, you can have now. The thing about cancers is they bleed. Okay, they bleed. Bladder cancer bleeds. And the number one cause of bladder cancer is smoking. So if you were a smoker and you have microscopic blood or blood in your urine, having a urine cytology test is a must. And that's just a urine test. You pee in a cup, they send it off to a lab, see if you have any markers for bladder cancer. And the good thing to know is that bladder cancer is considered one of the easiest cancers to treat as long as you catch it early. And the same is true with uterine cancer or cervical cancer. When you start seeing blood, that means something's going on. And that's what happened with me, is I started spotting when I shouldn't have been spotting. And it was like pale pink lemonade, like the palest of pink sheens. But then over a period of months, it got darker and darker and darker until it was finally blood clots. And that's when we stepped in and we started looking. And that's when they found complex endometrial hyperplasia with atypia. And the atypia cells are the ones that become the cancer cell. So, I think anytime you have a big worry like that, don't wait. Don't sit at home and agonize over it. Don't sit there for months and months and months worrying that you've got cancer. Just go ask them. Go have the test. Get it taken care of. That's what I did. I mean, I was absolutely convinced that I had cancer when I was first diagnosed. I flat out told them I didn't believe them. I said, I don't believe you. I have to be dying. This pain is so bad. And they did a urine cytology test. It was negative. And then I went to my OBGYN and said, I'm dying of cancer. You need to look. This was 25 years ago. And he's like, you're not dying of cancer, Jill. You have IC. And I went, I don't believe you. And I begged him to do a laparoscopy exploratory surgery, and he did. And I woke up in the recovery room and said, Jill, you don't have cancer, you just have IC. But the problem is I couldn't stop thinking about it. I kept thinking cancer over and over and over and over for almost a year. And what a waste. What a waste. If you're worried about it, just go have the urine test. And you'll have an answer very quickly. Just go ask the question. Carmela says, I just got diagnosed with a Tarlov cyst at S2. I went to a new doctor complaining of pain and burning, and he thought to do an MRI because he thought it sounded like it was coming from my spine. I'm waiting for a call back from UPenn with somebody who specializes in Tarlov cysts. There you go, girl. There you go. Melinda, you say that's you. What do you mean? I don't know what you mean. That's me. Are you spotting? Jill, what antibiotic? Judy, thank you for your kind words. I really appreciate that. Christine, what antibiotic did you take after you had your microgen testing? How long did you take it? None. I took none. I didn't take any orals. What I did is I used a topical because my discomfort was on my outer labia. And so I used mupirocin. And that seems to have cleared up a good portion of it. But I learned an important lesson on because so like, you know, vulvodynia is like really bad on the perineum, right? I mean, if on the inner lips, really in there, man, when that starts burning, man, that's fire. That's not what I was having. I was having discomfort along the hairline, and it felt like I was being hit. They diagnosed it as folliculitis, on like little pinpricks every now and then on either side, but usually on my left side. And those have persisted for 5 to 6 months. And my consult with the pelvic pain specialist this week was fascinating because she said, Jill, you have left side piriformis syndrome, right? And I was like, yeah. And she goes, I really think this is your muscle squeezing your nerves. And my answer back to her was, well, why do I feel so good if I use coconut oil and I use moisture? Because the surefire way to make it go away for me is just use coconut oil. And she goes, because that's just protecting the nerve. But underneath it all, I think that you're still spasming from your hysterectomy. And I think she's right. So anyway, I didn't take a topical. So what I did instead is, for the last 4 nights, I used a quarter of a Flexeril at night. And I will tell you that my the prickling is almost gone just with the muscle relaxant. So I'm going back to pelvic floor therapy in September. Melinda says, that's me thinking I have cancer. Girl, hun, you're not I wish I could just give you a hug right now. I know exactly where you are in your brain. It's like you cannot get it out of your head. You're just like thinking, I'm dying of cancer, or it's something really, really bad. You have to understand that when the bladder is injured, it hurts like hell. The pain of IC is rated equivalent to cancer pain. So it's logical and normal that you would think you have cancer when you have intense pain like this. But there's no connection between IC and cancer. None. Zero, zip, nada. No connection. And so again, if you're a smoker, that's a number 1 risk factor for bladder cancer. Just go get a urine cytology test so you can just be done with it and get it out of your brain. And if you have painful periods, or if you have, spotting, go to your gynecologist. Don't wait. You guys, listen, if there's one thing I've learned is don't sit on something. Don't sit on the fear for weeks and weeks and months and agonize and don't call anybody. As soon as you have something that scares you, call the doctor. Just call the doctor and go get it checked out. Carmela says, have you heard of any success stories of Tarlov cyst? Yes, I have. That when the Tarlov cyst pressing on the nerves going to the bladder is eliminated, that the things calm down. But honey, I haven't dove into that research recently. But the point is you found it. I mean, that they may have found it here, and that should be comforting. It's like, okay, now I don't have to take antibiotics. Now I don't have to do whatever. It's like, okay, it's a Tarlov cyst, and you're going to have laser focus on treating your unique presentation there. Tracy, the top doctor in Michigan is Ken Peters at Beaumont Urology in Royal Oak, Michigan, northwest of Detroit. Beaumont Urology, Dr. Kenneth Peters. Sherry says, I'm interested in the treatment you had where you got the tattoos on your ankles, neuromodulation. Let's see, let's see, how can I do it? Nope, I can't do it that way. Let's see. Let's see if I can sit on this and do it. No, see, I got my microphone there. There it is. Okay. See that right there? The little tiny black spot? That was the needle point, that's the tattoo. That's the tattoo I got when I was doing the ankle nerve stimulation, the post-tibial nerve stimulation. And that's what broke me out of my year-long flare when I was first diagnosed. And so this is a much less invasive way of doing neuromodulation. It's a step 4 treatment option. You want to do it before you do InterStim because there's no surgery involved with this. There's no serious side effects with this. It's simply an acupuncture needle inserted to a specific nerve area, and they attach an electrical stimulator to it. And the belief is that the nerve is malfunctioning, and if you remodulate it with an appropriate nerve pulse, you can get that nerve to behave appropriately. So it's now known as Urgent PC. Both Urgent PC and InterStim are approved by the FDA for Medicare reimbursement. But my preference for me personally is with the non-invasive form, the ankle stim first, because I don't want, I personally, I ran the support group where both of these were developed, and the horror stories for InterStim were nothing short of astonishingly bad. Whereas the success stories with the ankle stim were astonishingly good. And so I chose to go for the ankle stim. And I thank God I ended up in that group and not the early InterStim group. Would a CT scan identify a Tarlov cyst? I don't know, probably. Not sure though. Caroline, I had a cyst on my bladder wall 11 years ago. Doctor showed it to me. A few months later, he put me to sleep to remove it. Then I woke up. He said, well, the cyst wasn't there anymore. Oh, that's hysterical. Caroline, was it like a round cyst? Was it like a mass of some type? That is hysterical. It shows that healing happens. So it sounds like, I mean, it'd be interesting to hear how he explained that to you, Carolyn. That's fascinating. Absolutely fascinating. Well, listen, we've been going for 2 hours and 40 minutes now. And I'm sorry I'm a little sleep deprived today. The last 24 hours have been very hard for those of us in the United States. And I want to send out love to anybody living in Ohio and Texas. The last 24 hours have been nothing short of astonishingly painful. And I am so, so sorry for the grief that you are going through right now. I think we all know that this was terrorism. This was terrorism. And I want you to understand that the IC network is a safe place for you. I don't care what race you are. I don't care what religion you are. I don't care what sexual orientation you have. I want to help. IC has no boundaries here. It affects everyone. It affects the rich and the poor. It affects the Catholic and the Jew and the Jewish and the Muslim. It affects and the Buddhists and you name it, every single faith, including. I mean, it's just everyone is at risk here, and I want you to feel safe. I want you to feel comforted. I want you to feel listened to. I want you to feel like you're worthy. That's, and I got to tell you something. I got to tell you something. You realize I started the IC network in 1994, 25 years ago. The first time I put an African American woman on my front page, I had hate phone calls. I was astonished. I was absolutely astonished. I had people calling me saying vile things and telling me to stop that. And my answer was, fuck you. Honestly, really. How dare you? How dare you bring that into the IC network? I'm going to serve everyone, everyone that I can. And we're at a dark and chilling time. But again, I want you to know that you have a refuge with me. Any of you. Any of you. Okay? All right, my friends, listen, we just have somebody came in on YouTube. Hey, dude, listen, this is a real support group meeting for people who are crying in pain. We need you to respect that. This is not the place to come in and joke, all right? Yeah, all right. All right, last call for questions, my friends. Last call for questions. Last call for questions. Donna says, Jill, your integrity is priceless. Thank you. Carmela says, I've been an IC Network member since the 2000s. Yeah, baby. Hello, Alan. Nice to see you. Thank you, Debbie. Sarah says, can you do both? You know, yeah, I mean, if one fails, do the other one, but I wouldn't do both at the same time, you know, Sarah. I mean, seriously, start with the least invasive one first. It'll cost you less money. It doesn't have the risks of side effects. And if it doesn't give you success, then you could do with the InterStim trial. And if that doesn't work, then you're going to walk away from it. But if you feel better after the InterStim trial, then yeah, you might have the InterStim one. Carolyn said the cyst in her bladder looked like a boil. Oh, I didn't do the giveaway. Dudes, I didn't do the giveaway. All right. Here's our giveaway. A bottle of Bladder Rest, one person to somebody on Facebook and one person to somebody on YouTube, whoever is the first. And you know, I'm getting harder with my giveaways now, guys, because I am testing your knowledge. I am testing your knowledge. So, can somebody give me? Oh man, I might do it. I might do a hard one. You know, because this is like, you know, guys, this is like a $60 gift, right? So it's not like you're going to name a color for this one. Let's see. Okay, here's your question. What is the name of the top layer of the bladder? What is the name of the top layer of the bladder on the inside? Somebody give me the name of this. You can do Debbie, no, Debbie, that's this one. This is the epithelial layer here. What's the layer here? No, it's not epithelial. No, it's not interstitial. This is the epithelial layer. I need the layer of the mucus. What do we call that? Okay, Donna. Okay, Donna, close. That's close. Okay, nobody's. Debbie got it. Okay, Debbie on YouTube got it. Debbie on YouTube got it. Facebook, Sherry Diggs, you got it. It's the gag layer, known as the glycosaminoglycan layer, gag layer. I'm going to make you all nerds with me. All right, so Debbie Sokoloff and Sherry Diggs. You both have won a bladder rest. Now listen, if you don't want it, tell me so I can give it to somebody else. But if you want it, you've got it. I need you to email me your mailing address, icnetwork@mac.com. I'm putting these aside for you. There's your names on them. Look at that. Look at that. My shelf is almost empty. Holy moly. All right, so I got 2 bottles for two lovely, lovely IC patients. I will put them right there. icnetwork@mac.com. All right, I want to apologize for being out of sorts a little bit today. You know, again, pretty upsetting night. And but it is what it is. That is life in the United States right now. You know, we can't. You guys are funny. Yeah, man, I'm going to make you nerds. I am going to make you bladder. I love, you know, I mean, like I love biology anyway, and I love microbiology specifically. At my senior project in 1982 was the discovery of antibiotic resistance bacteria in bathrooms of hospitals and bathrooms at University of California. So man, it goes way back for me. I'm a total geek that way. Elise says, "Thank you for all you do for us, Jill." You're very, very welcome. You're very welcome. I love my job. I love what I do. Now listen, guys, I am not a doctor. I cannot give medical advice. My job is to give you knowledge, give you pros and cons, kick you in the butt, get you to go do some more research, and then get you into your doctor so that you can talk with the person who can give you medical advice. So if you've heard something today that you think is meaningful, I want you to read a little bit more about it. You can come to our website, the IC Network, and read about it, and then let's go kick some butt. Go back to the doctor and say, hey, you know what? We haven't really tried this, and we haven't really tried this. Got the AUA guidelines now. I know a little bit more about my treatment options. I'd like to try to do a few more things. What I don't want you to do is sit at home and suffer. If you're not getting better, don't give up. Go back. Go back. But it begins with your knowledge level, my friends. I mean, I say this every time. Nobody could ever tell me that IC's all in my head. I will kick their butt. I know what to say. I know what IC is. I can cite research study after research study after research study after book after book after book. And even then, every now and then, it still kind of happens. And it doesn't matter. It's not all in my head. It's real. I want you to be able to do exactly the same thing. And the reality is that I'm no different than you are. I'm just extremely stubborn. I had a doctor say to me, you will forever be a burden on your family. This is your life. Get used to it. You will always live in pain. And I said, I will prove you wrong, you son of a bitch. And I have proved him wrong. I started my first support worker from my bed 3 months later. I could barely walk. That was right before the September 1993, right before my hydrodistension, by my laparotomy to look for cancer. Within 6 months of that, we did our first conference. And you know what the great gift of doing something like that is it gets you out of your head. Because up to that point, I really thought I was the only person who had bladder pain. And when we brought in other IC patients and we started our group, not only did I see, oh God, number one, I wasn't alone, but number two, I got to see context, and I got to see I wasn't nearly as bad as I thought it was, that there were other people struggling far worse than I was. And that was important. But what's also important is remembering that when you help other people, you help yourself. And it's very, very important. Your homework is to commit one random act of kindness in the next 24 hours to somebody in your life. Okay? One random act of kindness. Whether it is, I helped a woman get off of a disabled woman get off of a bus yesterday. Just do something for someone else. Get out of your head. Okay? All right, my friends, listen, I can ramble, but I think I will stop. Donna. I would like to talk to you about IC Awareness Month if you are still available. Are you making dinner now? It's 3:30 here. Is it dinner time? I can call you tomorrow too. Guys, we're putting together all the materials for IC Awareness Month, icawareness.org, which you can see right there. Oh, I can show you. I can do a reveal. Where is it? Nope, that's not it. Crap, where is it? Here it is. I can give you the official poster for IC Awareness Month this year is this. How do you like that? How do you like that? That's our official poster for this year. So I will have this up on the IC Awareness page website. You'll be able to download this, print it out. What I hope you will do is print it out and go give it to your doctor's office. Just get it up on walls. If there's anybody out there who loves graphics, I would love to adapt this to include the symptoms of IC. I just didn't have time to do that. We will have a poster contest this year. We will have a meme contest this year. Becky says you would like to help with IC Awareness Month. I tell you what, for everybody on Facebook, for anybody who wants to talk about IC Awareness Month, can you come on over to YouTube right now? Because we're going to talk about it on YouTube, in our YouTube channel, which is youtube.com/ICandJill. If you want to come over in the next minute or so, just go to youtube.com because I have some graphic questions. All right. So I'm going to end Facebook. I'll see you guys later. We'll be doing a drop-in sometime this next week, I'm sure. Goodbye, Facebook. I love you, especially if you're in Ohio and Texas. Not only do I love you, I'm giving you a big giant hug too. Okay. All right. Donna and Becky. Can you guys just help me for a minute? So I'm really struggling with graphics right now, like terribly. This is not me at all. Normally an idea comes and we're good and life goes on. In this case, hi Sherry. In this case, I am really struggling trying to come up with a graphic campaign for it other than the poster. And I am wondering if you can open up your window. I mean, we're talking here on YouTube, but if you can go to the IC Awareness Month Facebook page. And you know, I might be able to actually, I just need your opinion. And anybody else here who's sticking around? Let me know when you're there. And let me print this out. So I had two different, if you go to the photos on that page and go to profile pictures, you'll see one that's a butterfly, a butterfly wings with a ribbon. And then there's another one just with a traditional ribbon. Which one do you like? Do you like the one with the butterfly and the ribbon, or do you the butterfly shape, or do you like the one just with the teal ribbon? So you go to facebook.com/IC awareness. But stay here. Open up a separate window. Any thoughts? Can you see it? All right, so look, do you guys like this one? Do you like that ribbon with the wings on it? Donna, Sherry, what do you think? Hi, Mason. Hey, listen, this is a support group meeting. We're planning a big national campaign for something. So, it's not a place to joke around and laugh. I'm just telling you right now. Okay. Do you like the ribbon with the wings? Or would you like a more traditional ribbon? Here, I can print that one out too. I mean, usually I'm just you like the butterfly? Okay, so let's see if that's going to print out. Paper jam. No. Okay. Let's see if that other one prints out. Okay, so now the second issue is the campaign header. And the one that's on the page right now is a fairly young group of people, multicultural, with IC Awareness Month, We Are Stronger Together. So again, go to photos on the Facebook page, and this time click on cover photos. And there are 5 different ones. So one is kind of a full color illustration. Let me just print these out real quick. And thank you. I really need your help. Becky, you're absolutely right. And for anybody wondering the color, okay, so this is the typical. Okay, so you have the choice between the butterfly or the ribbon. Okay. I think the butterfly is very different. Okay, now for the main image that's going to go over on the website and everything else, we could do something like this. Of course, the problem with this picture is there's no men, and I couldn't find one with men. Okay, or we could do this one. Of course, the challenge with this one is this is a younger audience. Elise says the only negative with the butterflies is the butterfly is a symbol for thyroid disease. Yeah, and in the IC world, our symbol is a daisy or a sunflower. Okay, so the challenge with this image is that it's young people. Mason says everyone wants to feel young, so maybe that's one. Mason, that's a good point. The one that, hold on, the original one that I was going with. Hold on, let me print it out. I literally spent all day Friday working on graphics, and I just couldn't. Okay, and this is the original one that I had done about a month ago. And my concern with this one is that I thought it was a little too dark. I mean, I love the symbolism though. So, okay, so help me. Okay, so we've got these kind of graphics where there's no real faces, very neutral, all cultures, all faiths represented, unfortunately, no men. This one, or this one. So 1, 2, or 3. 1, 2, 3. Okay, so Donna likes number 3. Rebecca likes number 3. Sarah likes the second one. Donna likes the second one. I don't know what to do. I want a decision. We're going to make a decision now. I swear to God. We just have to we just have to deal with it. All right. So let's do another vote. I can't, my gut is so confused, Donna. I wish I could go with my gut. My gut is so frustrated that it's just not coming natural. Okay, guys, here are your finalists. This one, number 1, or this one, number 2. 1, 2. Which one? Number 1, number 2. All right. Oh, you have no idea. You're taking such a load off of my shoulders right now. I know. See, like I'm torn. Becky says, I like the representation the number 1 provides. It's like, oh my God. This is such a freaking great way to do a meeting for IC Awareness Month. Oh my God, you guys. This excites me that I could get your feedback here. What we should do is we're going to start up a Discord channel so we can all talk. The problem with number 3 is it's kind of the ableist. I don't know. Okay. One, 2. There's no longer a 3. Number 1 or number 2. I'm thinking it's this one. You don't like this one because... Ah! Oh my God. Okay, you guys. No. 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 Oh my God. Okay, this is how I was feeling on Friday. So, okay, so you're changing your mind. Now you like this one. You like, okay. JJ says, I see so unseen, but it is so real. The dark one sort of speaks to that. All right. Number 2 it is. I'm switching it out right now. It's already over on, if you go to icawareness.org, You guys go look at icawareness.org. And let me just switch this on. All right. Oh, wait. Did I? Okay, hold on a sec. Okay, so all right. So if you go to icawareness.org, you will see that I used that picture, but I made it even bigger. And then every person in that had a name. So one was I see hope, I see strength, I see courage, I see support, I see sister, I see brother, I see activist. I see survivor. Let me print that out real quick. So Donna and I have been working together, just trying to come up with some concepts here. And that's right, men get it too. Men get it too, my friends. Let me print this out. Hold on one sec. Of course, I printed out the whole page by mistake. Silhouettes, the silhouettes. So I kind of, I really think that, my theory behind IC Awareness Month, so I don't know if you guys kind of know the history of this. So what happened is all the IC awareness activities were done by the company that made Elmoron. So literally for 20 years, any IC awareness that was done by that company. And it was in October. And they had a marketing company who was doing it, who put in, I don't know, they probably put in $10,000, $15,000 a year to do it. And the tragedy of that is that their IC awareness campaign was focused almost entirely on promoting Elmoron. It was very, very frustrating. And then they got in a big fight with the other IC group and they walked away. And I know this because they called me and told me about it. And so IC Awareness Month all of a sudden had no sponsor. So I waited a year because I thought the ICA would pick it up, and they didn't. And so when they decided they just didn't see it as an opportunity, I took over. I started coordinating IC Awareness Month about 10 years ago. And one of the first things we did is we decided to move it out of October, and we had a big vote. The problem with October is it's Breast Cancer Awareness Month. And so there's just absolutely no hope of getting PR attention in October when any of that limited column space goes to breast cancer. So we did a big national vote. We had about 1,000 votes at the time, and people picked September as the month. And then the second question was the color. What color did they want to use? The color that the Elmoron people had used was teal, turquoise teal. And then somebody at some point in time said it was navy blue. We have no idea who said that. That was certainly nothing that was real. And so we had a vote again, and everybody voted to keep the teal turquoise because that was the color that was already associated with IC. And I can show you that. You know, the original educational materials were incredible. They were absolutely incredible. So here's an example of one of the early IC awareness things was this booklet on IC written by Parsons years ago. It's completely outdated now. And then you can also see that they kept the teal and white in the all the Elmeron stuff, and they used to pass out little tanker trucks, cement mixer trucks in turquoise at conferences and things like that. So that's why it's in October. That's why it's teal. And then the third thing that I did, and I kind of made an executive decision on this, is I moved it from a week to a month, because it's a hell of a lot more work. And I'll tell you, I'm kind of a little tired of it right now, only because it's been 10 years. On the other hand, there's so much that we can share about IC every month, every day. We can, that patient can talk about it for a month is important. It's important. And so that's why we converted it from a week to a month, again, like 10 years ago. It's modeled after National Women's Health Week. So the other decision that I made was that I was not going to use this to promote the IC network in any way, shape, or form. IC awareness is not about the ICA, and it's not about the IC network. It is about IC. And the challenge here is that I don't live in your town. I don't know what your challenges are. I don't know what the challenges are in Tennessee or in New York or in Connecticut or in Arizona. You know, we're one office in California. Well, two offices in California. And so what we try to do with IC Awareness Month is give you the tools so that you can look at your community objectively and ask yourself, are they treating IC patients right? And if they're not, giving you things that you can do to change that. So giving you posters to put up on the wall, giving you a press release, which I have to write this week, that you can give to your local newspapers so that you can tell your story of IC. The ICA is finally, they denied IC Awareness Month for many years, and finally they jumped on board and they're doing IC Awareness walks. So they've got 2 walks scheduled, one in San Diego, and I don't remember where the other one is, North Carolina, I think, in September. That's fantastic. Power to them. But anyway, my goal here is to just try to give you resources to make change in your community. And I don't want the IC network or the ICA to be the superstar of the event, because we're not. The superstar is you. The superstar is the IC patient. Newspapers don't want to tell the story of me and the IC network and how I founded it. They want to tell the story of how a life was changed. Your story is the story that's newsworthy here. Are you better or are you worse? Were you ignored by doctors for years? Did you find hope? Have you not found hope? Have you been accused of it being all in your head? All that sort of stuff, you know? So I want the stars of IC Awareness Month to be you, So there you go. Thank you for making that decision. I'd really love to do t-shirts. I'd love to do a t-shirt that says, you know, IC activist or IC warrior or whatever, something like that people can wear. So I have a love relationship with t-shirts right now. I wear t-shirts all the time, and I'm being very active. I'll show you. Hold on, I'll show you one. I have a whole bunch of activist t-shirts that I'm wearing now, and they're all black with white printing when I get pissed off at what's happening in our country. And so this is the newest one I got. I've got like 5 of them now. Women for Warren. I'm not supporting. I mean, I'm getting from all the candidates, not just one. But I want there to be something that we can wear. Yeah, Becky, that would be great. Organizing an event at your library. Donna, you have the equipment to make t-shirts, really? Donna, okay. Oh, Donna, done. Done. If you got the equipment to do it, we just need to come up with a design. And I mean, it can just be something as simple as, the wording, we are stronger together, IC Awareness Month, or it could be a beautiful design. I think you like to design, right? I kind of like to see it in continuing with the turquoise teal theme, kind of, sort of. But that said, when I'm angry, I wear my black shirt with my white letters because I'm getting angry kind of a lot right now these days with what's happening. But okay, so like I also think it's really important to find some humor in the situation. And I'll tell you a t-shirt that I've been dying to do. I've been dying to do because I have a really ridiculous sense of humor. Is I want to do t-shirts that says, "I see yours do it frequently." I have a really warped sense of humor. I gotta find some funny. I see yours do it frequently. I love IC Warrior. I love IC Warrior. I was just worried that somebody else was already using IC Warrior. Don't stop it. I would totally wear IC yours do. Come on. People would ask us what IC is. I think it would be a hysterical educational tool. I would totally wear it in these meetings. I would. So maybe we need to have 2 t-shirts. Okay, Donna, you're hired. So, you guys have any awesome, JJ. So, what can you think of anything else you'd like to see on a t-shirt? I mean, it could be. I mean, I like IC activist because I think at this point in time in our country's history and in our history, we have to be active. I mean, we got to role model that and embody that, not only in getting patients to the doctors, but also just in our nation in general. We've got to be, we can't sit in silence anymore. So I like the idea. Or we could do big IC, a big IC, and then in small letters, hope, strength, courage, support, activist. Donna, that's amazing. That's amazing. And I'm assuming that we're going to use, JJ says, looking good on the outside, but pain on the inside. Don't get the greenish teal, get the turquoisey. The turquoise is better than, I don't like the green teals. I like the turquoise more. Almost like well, you can see the difference behind me. So like the turquoise of the IC network versus the teal of the awareness thing. I think the bluer tone is better for clothes. I don't think people wear greens as much. Yeah. So do you want me to send you graphics or do you want to work on the graphics and send them to me? And I'm assuming, across the bus line. It'd be great to have something on the back too. Like I see Survivor on the back. Like I see Survivor on the back and okay. Hey, does anybody else in here draw? Sarah says one for nursing and doctors. My installation nurse would love it. So what do you think, Sarah, what do you think she would like to, she would put on it? I see warrior. I wasn't sure if that was trademarked or not. But I actually think we were the first to use IC Warrior years ago. Look, there's a website, the IC Warrior. So the IC Warrior website, it has been inactive for 6 years, pretty much. Oh, she's running the thing on Reddit. I haven't really done anything on Reddit. I don't have time. There's so much social media. It's like, who the heck has time for all these? I don't. But wow, look at this Reddit forum. I haven't looked at this in ages. Wow. All right. Okay. I did. So yeah, I don't think we should use IC Warrior. I just think too many other people have done it, and I don't want to get into any copyright things. Okay, Donna, that would be great. What about IC? Hey, Alan, what would you wear as a man? I mean, we could do IC strong. I mean, we could easily do IC strong because everybody's doing strong. I mean, there's no, I mean, my town burned down. We were Santa Rosa strong or Sonoma strong or Gilroy strong or Dayton strong right now or El Paso strong. We could do IC strong. Or we could just do We Are Stronger Together, IC Awareness Month. And then on the back, we could put, you like IC strong? Because it's like, I see a strong person. You like IC strong? Yeah, because okay. All right. Okay. Anybody else have any other ideas out there? So it could be literally hashtag IC strong. And then underneath that, and then it could say IC Awareness Month. And on the back, we could say IC Survivor. Sherry says you feel more like a victim than a work. Well, yeah, but girl, that's the point, is we want you to put this on and feel strong. Hello, Yermi from Argentina. Nice to see you. All right, so the friend's going to say IC strong, IC Awareness Month. I hate to put the year because then yeah, I know. That's why I don't want to tread on their toes, right? My fear is if we used IC Warriors, we would be treading on their toes and offending them or saying that we're trying to steal their concept. Again, even though I think if we went back in time through Wayback Machine, I would bet that we would see IC Warrior on the IC network before anybody else used it. Yeah, we could it would be great to do a t-shirt every year. I would love to do a new t-shirt every year. I also want to do ICers do it frequently, because it's just funny. Okay, and then IC survivor on the back. We'll have to look at the cost too, because I'm assuming okay, so this our goal is you see I see fading. Yeah. The goal would be the cost to patients would probably be, ideally under $20, like $19, 17.50. I mean, so we have to look at the cost of printing on the front and the back, just to get where that is, right? And then any funds raised from it, we can either donate to research. Um, uh, that would be fine. Donna, I don't even, I mean, so what I can do is if you wanted to run the campaign for the clothes and have your own website for it, that's fine. Um, or we can run it through the IC network and put it on IC Awareness Month. Sherry, girl, you are stronger than you have ever been in your life. You just don't see it, but you're here. You're strong. I have no doubt of your strength. None at all. So anyway, so the goal would be to keep it under $20 if at all possible. And then so the press release costs $500 to send out. I never charge for my time. I never charge for, the IC network donates my time and the website and all that sort of stuff. So we could donate any extra proceeds just to the IC Research Center at Beaumont Urology, and just say that the funds raised will go to Beaumont Urology. I just don't want people to think that they're coming to me, the IC network. I want a very clear line there. You know what I mean? I don't want anybody to come back and say, "Look at Jill, she's trying to make money off of IC Awareness Month." I have never done that ever, 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 ever. Sherry, it's kind of an interesting concept. I see in the shadows. I see I see in the shadows is fascinating. And you know what? I actually might be able to put that in the press release, because I already know what I'm going to say in the press release. But that would be really good to incorporate into the shadows. Okay, Donna, or let's just look at pricing this week, because the other thing we could do is we could just put it on Cafe Press or lookhuman.com, and people can pick out whatever kind of shirt they want or sweatshirt, and we don't even have to print them up. We can just do the design, but we'll just look at the price and play with it. Okay. So you want to try to talk tomorrow? Does anybody else want in on having discussions about the t-shirts? More voices, the better, my friends. Come on now. Nobody's left out. If you want in, you can be in. Okay. All right. That sounds good. So good. We finished a couple of big things. The only thing I have left is a press release and then the blast email. And we get the t-shirts up and running, and we are gold. Oh. Anybody here good with graphics? Because all of our IC Awareness Month facts were designed with a different file size than what Facebook wants now and what Twitter wants now, and they all need to be redone. 30 days, half September, 30 facts, and we need to redo all the graphics into the correct size for Facebook and Twitter. Is anybody like working with graphics at all? You know what the advantage of sitting here is y'all can't see my neck. I have I have aged a decade in a year after that hysterectomy. And now I have got saggy neck. It's so frustrating. It's so frustrating. I hate looking at my face right now. Yeah, but thank you, Becky. But we do make money because we do the sale. That's what takes my time. But in the old days, you have to understand that they didn't want the IC network. Nobody, the ICA did not want the IC network. They told me if I did it, they would never, ever, ever acknowledge my work. I had offered to build them the first website and online support center in 1993 or 1994. After running support groups for a year on America Online. And they told me it was a stupid idea. Nobody would ever use the internet for support, that I needed to know my place in the IC movement. And they were not interested in doing it, that nobody would ever use the internet. And I said, well, if you don't want to do it, that's fine. I would like to do it. And that's exactly how the IC network got started. But from day one, the way they decided to try to undermine my work, and believe me, they did everything they could to do that, is by claiming that I was profiting off of patients, even though it was free. Like the first 5 or 6 years was entirely free. I didn't sell anything. And they kept telling people, don't trust Jill, she's making money. It's like, where? There's no money coming in. My entire retirement fund was emptied and went into the IC network. But we did have to start making money, and that's why we sell books and all that sort of stuff. So anyway. I'm using, I always forget to do my neck. Donna says, make a graphic from the silhouette picture and use it. I've got it. Yeah, I definitely have it. I can, I paid for it and everything. Okay, so we'll do the graphic with, okay, I'll do it. I'll do that tonight or tomorrow. And I'll send it to you. We'll have to play with sizes and all that sort of stuff. Okay. All right. Any last questions, my friends? Any last questions? So we'll be able to get into Discord soon. So Discord is a live chat server. It's kind of like our old chat room, only it's voice, where everybody can talk. You just have to let everybody talk. It just has to be moderated really, really carefully. And for anybody who's stuck around here, we've got 9 people here in the room. I'm going to need moderators for the Discord and for Twitch, and I will pay you. I will pay. Not a lot, but I will pay for the help. We just can't have unsupervised discussions. Nice, Donna. Nice. We will work it out. Because I really am excited about doing these streams. I want to do more. I just wish I were 20 years younger, and I look 20 years younger than I do right now. But it is what it is. But if we go all voice with voice meetings again, along with this, we have to. We got to have a good team of moderators, because you got to be able to go in and shut people off who are trying to mess with the group, or the people who are being inappropriate. It happens. So, all right. Okay, I'm going to go have a drink of water. I'll see you guys later. And Donna, I will talk to you. Thank you guys for hanging around, and more to come. I feel better now. I feel more optimistic now that we made those decisions. So, okay, guys, I'll see you later. See? I need a facelift, but I'm not going to do it. I could do this. I could do this. Right here. Right? Somebody just came in as I was doing that. We're just ending our support group meeting, whoever just came in. See you guys.